Calling the meeting to order, 10 o'clock on Tuesday, August 24th. This is the workshop, and I'm going to turn it over to Dr. Moore.
Thank you, Mr. Chair. Just a little bit of housekeeping before we jump into what will be a lengthy agenda. I am going to remove item J from the agenda just based on time and still waiting to collect some information from board members. I think the bulk of our meeting will focus around item number B. So if we do run out of time, items C through I have all been, C through H have all been presented. So we'll present them, each item separately, or allow the board the opportunity to ask specific questions regarding those items if time does not permit. Obviously, that would be done at the will of the board. But our first item is review of new policy unitary status regarding sustainability. On May 25th, Dr. Jones brought an item to the board requesting that the district work with the local NAACP to develop a unitary status policy. The intent of this item was to create policy to ensure whenever unitary status was obtained, whether it be in January 2022 or January 2027, that this policy would be in place in order to sustain the work. It was shared and realized and acknowledged that far too often when a district obtains unitary status, within a number of years of hitting that milestone, that district regresses back to the data points that ultimately led them or put them in that particular situation. Knowing that to be the truth, knowing that to be our reality, this board took a stance. This item was approved unanimously to ensure that we take control of what could be a negative outcome in the future right here and right now. So we've had the opportunity through our new equity coordinator, Dr. Shafty, to work with representation from the NAACP to create a policy. We did norm on a policy. That policy was then shared with Mr. Seymour's, I say Mr. Seymour, but the district's new climate task force. And this is a number of individuals across the county really to ensure, what's the name of the committee, Mr. Seymour?
The Climate Task Force is an acronym for Convening Leaders in Maximizing Access to Education.
Say it again. That was good.
I know.
You had that.
Yes, the Climate Task Force is an acronym for Convening Leaders in Maximizing Access to Education.
So after sharing that, we did, our school board attorney did hear from NAACP's attorney late Sunday evening, requesting not to be embedded into the policy in itself. Honoring that request, I did upload this morning the revised policy. I also sent it to board members last night, so you had enough time. I know there's a lot on your plates right now, but given the late notice, I did want to be responsive to this board. So there are some minor changes to this policy from what was posted. The first change is around Superintendent's Unitary Status Sustainability Work Group. This work group, initially written, would go into effect once unitary status had been fulfilled. As you know, in our joint plan, once we obtain unitary status, there's an additional 2 years, which we jointly agreed upon and signed off on, to continue the equity committee under its current structure, to continue the monitor of that work. Because they are no longer wanting to be connected with this policy, we shifted it and all requirements associated with the joint plan have been fulfilled. So changing that is a shift in implementation timeline, meaning that this policy would go into effect after the agreed upon amount of time of the equity committee would be implemented. We also made the shift which removes the monitoring and authority that the NAACP had in the continuation of this powerful and purposeful work. We shifted it to, we will be selected 5 members annually during the organizational meeting. So the shift in practice here, very similar to what you all do on an annual basis during your November meeting, is the opportunity to select individuals through an application process. That's procedural. I would create that, bring it to the board to have it signed off on. Those individuals across the entire community would then submit an application and resume process to the board. The board would then select 5. Those 5 would select a chair. So it ultimately expands the ownership of implementation of this particular work. And it did shift, which is a request from one board member, giving the board the authority to select those 5 individuals versus myself, which I'm absolutely fine with that. Those are the changes that are standing in front of the board. What we're looking to do tonight is to take this policy and set it for public hearing. So you are not approving the policy tonight. It has to go to public hearing. So the simple action this evening is to approve it for public hearing. That is the item. I'll be happy to answer any questions. Or Mr. Seymour will.
Dr. Jones?
Oh, thank you, Dr. Moore, Mr. Seymour, and Dr. Shafty for this work. Obviously, been in the district a long time, and I really, really want to make sure that when we do get unitary status, that we have a commitment, our board, our superintendent, actually our community, to make sure that we continue with the expectations that we have in the DSEC plan. You know, it's not about us, it's not about you, it's about our students and their success. So hopefully we will move on with a good policy, continue to look at how it will help students, have our mediation, hopefully get to unitary status. But again, this is something that I think that Indian River County needs to do to show our commitment to these students. So I appreciate the work Dr. Shafty and I believe Dr. Warrior did on this policy, and it re-emphasizes what we need to do for these students in all these areas. And I know we've done a lot of work in that area as far as recruiting African-American teachers. I think, Dr. Moore, is it 13% this year?
Our goal in our strategic plan is to move to 13%. As you know, upon arrival just a short 18 months ago, it was just at 9%. So we obtained 2 percentage points last year. Currently, we're sitting just below that 13% mark. So we're very proud of the work that Ms. Hofer and team and principals have done.
And I know there are other areas with the achievement gap, extracurricular activities. I know Mr. Seymour is working hard with that, with middle school athletics, to make sure that we don't have barriers for our students if they can't pay to participate. The bus depots that we're looking at for school choice, a lot of information. Of course, the essential one is the achievement gap. We had some gain with our 3rd grade African-American students. This is not the year where we had school grades, so we'll have to continue to grow there in closing the gap in every area. But I think this policy is just essential, imperative for our students. Thank you.
Any other comments? Mrs. Zara, did you have a comment?
Dr. Shifkin.
Dr. Schiff?
This is not a fully fleshed out comment, so bear with me for a second. In moving to the process of the board selecting equity committee members, or I don't know if we're even going to still be calling that, because it is at some point down the road that this will occur after we've achieved unitary status from the court. I'm not sure if we need to write in or simply be aware, because this board may not be that board. In fact, it's highly likely that this board will not be the board, the exact same board that is appointing those members to whatever this unit is called. One of the things that's important is that when people do this work, that they have some background in it, that they have some awareness and some history and some knowledge of what the work actually is. It's important to depoliticize it. It's important to have it be community-based and driven. And I'm not sure how we ensure that. As board members, board members will select, and I assume there will be some application process for that. I'd like there to be some structure to ensure that who is selected for this committee, and I'm not sure how we build this, so I don't know that it's in the policy or if I'm just voicing it for awareness at some point in the future. But that the people who may in the future be selected to serve on this have a strong history, commitment, experience, and knowledge of what these issues are, why we're doing them, and how to forward them in the district. That doesn't always happen, and I don't know how we ensure it other than to hope for the best at some point in the future. But but I want to voice that because it doesn't always turn out that way.
So I, through the chair, completely agree, and what I will do leading into November, and you're right, this may be work that is bold and courageous, but it may be work that's 3 or 4 years down the road. But we do need to look at the process in selection of committee members that board members do on an annual basis, creating something very similar to what you said. These are the expectation, this is the body of work, this is the level of expertise in which we're looking for. This would be the rubric in which we would use to select not only this committee, but other committees. Quite honestly, the selection process isn't as tight as I would look for all committees. That's things that I'm very familiar with having. This is the function or the purpose of this particular committee. This is the level of expertise. This is the volume of time in which you'd be committing. Those things just procedurally do not exist here. So as we lead into that work, I can create that, bring it to the board for perusal, because ultimately this is action being taken by the board to approve, and we will be able to have that in place. And then, 5 years down the road, 10 years down the road, the then board and superintendent, or myself, will have the opportunity to revise or modify that if they see fit, but creating or tighten up the process for all committees in which you select members for is work that we need to do leading into November.
Mr. Zara, did you have a comment, question?
Yeah, I was hesitant from the beginning with the sustainability policy, only because I just didn't think that, I thought we were being a little bit too premature. I didn't think that we had the relationship where it needed to be with the NAACP to move forward. And my initial, when this was first discussed, my initial thought was, let's plan it, let's hold on to it, let's work so that we can build consensus, and then moving closer to December, when we submit our final report and request unitary status, by that time, the hope would have been that we could truly collaborate with the NAACP, provide it to the courts with the full understanding that we are on the same page, that we both agree to this new sustainability policy moving forward. And so that was and that's why I was hesitant at the beginning, as you all recall. I'm still hesitant. I still think that we should wait a little bit. Clearly, to some effect, there was some legitimacy in what I was thinking, because the NAACP does not want to be a part of this now. I believe that that's the main crux of what this sustainability plan is missing. If we bring this to the courts and say this is what we want to do on our own, how are we going to show them that we're working collaboratively and that we both agree?
Through the chair, I think our primary responsibilities are to the children of this community. And I think this policy ensures, regardless of who is on this board, who is sitting in this seat, that in this moment in time, we have taken an aggressive action in order to ensure this expectation of not going backwards, where the research says it continually happens, is our priority. And we want to be collaborative. But we need to be collaborative with all parties. And, these shifts or modifications, and I agree, and I acknowledge the spirit in which you are speaking. But at the same time, opening it up to the entire community, spreads the level of authority to those 5 members who can be across the community. So it allows those who have an interest in doing this work and ensuring that this board is held accountable, and ultimately the superintendent is held accountable, not to regress or not to look the other way, or not to have the attitude that, oh, thank gosh, that's done, let's move on to something else. This sustainability policy puts a very strong practice in place, or a very strong policy in place. A little bit off topic, but I've had the opportunity to share this policy with a number of people who have invested in me and mentored me as I have grown professionally. And they look at it and they say, this is a lot. This is requirements and in some ways dictating work to the superintendent through policy. I don't think very many superintendents would say, hey, this is something I want the board to approve, but it's that important. It is driving the work of the superintendent. Most policies tell the operation of the work. Superintendent figures out how to get it done. This has annual deliverables, which ensures the conversation isn't forgotten, and it requires corrective action when the information or data points aren't significant or continuing to improve.
So, I don't disagree, I don't disagree at all. I think in part of taking a look at it from a different stance, if this sustainability policy had not ever been brought up or suggested, the work that's all in here was captured and would be captured within the plan, within the joint plan as it is right now. So that stays. It's basically the same thing, minus the change in work groups supplanting the equity committee. Minus that, it's basically the same work. We've also captured it within our strategic plan, and it is still part of closing the achievement gap and ensuring that all children succeed is still the work of the district. So minus the policy being proposed, the work would still continue. This policy does not tell the district, I mean, it's good policy, I'm not saying that, I'm not criticizing it. I'm just kind of trying to take a different look at it, only because this would not be a discussion right now had it not been for the court order and the relationship that we are trying to have moving forward with the NAACP and the work of raising achievement for Black and brown students in our district. So I'm a little bit on the fence now because this new news just kind of threw a wrench in for me. I know the work is important. I'm not discarding that. I'm not discarding that without this, we would not do, I'm not saying that without this, we're not going to do the work. It'll just fall to the wayside because that's not going to, I don't believe that would happen. There's too much at stake, especially with the implementation of this being integrated within our strategic plan. It makes a big difference. So that's where I am, right? So I'm on the fence just within 24 hours from the emails that you sent. I understand their concern. I understand, I believe, well, I won't belabor it. So that's where I am. It's tough.
Mrs. Barrenborn.
Well, I guess I'm last on this, and I guess I should speak. I wasn't going to, but I'm a planner, and I appreciate the fact that you put this out this early. I think it gives it time to be vetted. I don't think we should vote on it tonight. I think this should be something that we think on
Yep.
and look at for a month or two and allow community members to tell us how they feel about it. And but I'm a planner, and I don't like to do things last second. And because, let's say we get unitary status, something happens and we get it in November, December, right? I wouldn't want to be coming up with something like this then. So I appreciate the fact, Dr. Jones, that you brought this forward now. It's interesting how many times, though, we have thought we were coming together with the NAACP, and then always at the last second, something changes.
Yeah.
And I'm not sure why that continues to happen, but I think we have to keep going with the work that we're doing. I think this also sends a message to the judge saying, hey, we believe in this process, and we're going to continue it with or without you. And I think, people, our community should be appreciative of that, because you're right, there are so many communities in the state of Florida even, that have gotten unitary status and then fallen back. And we don't want that to happen, especially after all this time. So, we're not in a fight. We're in a position where we can say, you know what, I think once we achieve unitary status, we want to make sure the systems that we put in place are going to continue for kids. And that's the way we need to look at it, is for kids. So I think, thank you for bringing it up, and I think let's sit on it and look at it for a month or two, and then be ready to go once we receive unitary status, whenever that may be.
Yeah, I don't have much more to add. I do think that it's frustrating at times. You get to the goal line and you can't get it into the end zone, to use a football analogy. I thought that this was, at least maybe it was a hope, and I know hope's not a very good strategy, but it was my hope that early on, and some of the feedback from Dr. Shafty and you was that there was some agreement on this need for something like this. But I do think, as you point out, Dr. Moore, the bright side is that this isn't, it will not be perceived as something that was developed specifically to deal with the NAACP, that this is a policy that's to benefit all kids within the community. And I think the challenge is going to be to come up with a set of qualifications for people if they choose to want to be involved in something like this, that there's a minimum level of either experience or, I'm not sure what the right choice of words are, but you covered that this is not just a group of folks that all of a sudden decide they want to get involved, but they've got to have some credentials, something in their resume, let's say, that would suggest that they can really add value. And it does have the opportunity to open it up to the entire community, so I think it's good, and we can sit on it, digest it, and at some point in time, I'm sure we'll have a vote, and all you can do is the best we can do, and I applaud you and Dr. Shafty for the effort, Mr. Seymour for the effort put forth to get to this point, and
through the chair, my recommendation would be to set it for a public hearing. That's the action that's being taken. That provides us the opportunity to expand, let it be posted publicly, let it be out there for the entire world to see. As you know, when policies come back, you set for public hearing. After the 30-day requirement, it comes to the next board meeting where the public is afforded the opportunity to speak through its concerns or ideas or thoughts regarding the particular policy. That's typically, as you recall, when we pause a board meeting, have a public hearing, no one's there to provide any comments, and then we resume the meeting. So maybe if we were to take this, set it for public hearing, put it out there, we might actually get some comments, and that would give the board a deeper look and better understanding as to the course forward.
Mr. Barefoot?
yes, ma'am. Go.
Before we finish this conversation, I want to make sure we're clear about what action is moving forward. 2 board members have expressed that they would like to put it on hold for some reason. Other board members seem to be in favor of it. It has impact on whether or not it stays on the agenda or not for tonight, correct?
Through the chair, it will be voted up or voted down.
Right, but the meeting is to put it for public hearing. So
Correct.
we're either going to vote for it for public hearing or we're not. Which means then that either we leave it on the consent agenda and it goes through with the consent agenda, or it's moved to action and we have yet another conversation. I tend to agree with Dr. Moore that the point of putting it out for public hearing is so that people can comment on it and review it. If at the end of that period we find it insufficient, we cannot put it forward as a policy. We can vote to reject it as a policy at that time. But we spend a tremendous amount of time trying to figure out how to move this work forward. From the beginning, I voiced and was in favor of having this be more broadly reviewed by the committee and by the community, and more inclusive of a broad swath of the community, including but not limited to the NAACP, which seems to be the direction in which this new policy takes us. So I would support I would support moving forward with it. I think the 30 days of public comment allows us that time for reflection, and we're not voting on anything until then. So I would be in favor of moving forward with it.
Dr. Jones.
Yeah, I agree very much with the 30 days, and obviously, we're all hoping for unitary status at some point. And when we do get unitary status, this policy is ready. I know the amount of work and time that took to bring this policy together, led by Mr. Seymour and Dr. Shafty. And as I said earlier, we just want to make sure this moves forward for our students. It's not about us, it's not about any organization, it's about our children. These are essential to achieve, continue what we want to do after we receive unitary status. And as Dr. Moore said, I think this is I don't know of any other district that's done this, and we can, I know Dr. Moore and Dr. Shafty have researched that. It's just something that we need to do for our students. And the 30 days gives us the time for people to look at it, review it. NAACP can have information on it. I think Dr. Ware helped with Dr. Shafty, so we may need to get more input, and that's fine, because we want it to work for our students.
Mrs. Barrenborg.
Yeah, oftentimes when we are developing policies and we give that 30-day window, oftentimes nobody comes to speak because they're not aware of what their rights are to speak and what the policy is and all that stuff. That's why I said wait 1 month, because I think we need to advertise this. We need to put it out there. We've gone this long, what, 1953?
67.
67? Okay, I know there were conversations about the 50s too. So since the 60s, we have been working on this, right? And now all of a sudden we have a new policy that we want to move forward, and we're going to give people 30 days. So that's the only concern I have. I appreciate all the work for this. I like it. I think it's great. But I also think we need to convey this message out to our community. So anybody that wants to speak on this. Now, in the past with policy, yeah, we say it in our board meetings. How many people really watch this? I mean, lately we've gotten all kinds of action, but
A pretty good number.
yeah. So I think it's important, though, that this is well advertised. I'd be fine with it for the 30 days if I felt like it was really advertised well on the front page of the website, information out there, then I'd be fine with it. But I think, like any other policy in the past, people don't come and speak on it because they don't know and then find out later, oh, I could have spoke on that. So I think, sometimes people don't understand government and how it works. And I think that it's important that we educate people on what their rights are to do for this policy.
And we would, through the chair, push out a lot of social media and awareness around it to give a level of assurance to this board that this isn't the typical logistical policy that's being approved, but a policy of power and purpose. So we'll make sure that happens.
Mrs. Rosario.
Yeah, I'd just like to add, how long has Dr. Shafty and Dr. Warrior worked together thus far? Is it throughout the summer? A month, approximately? Okay, so about a month, right? A little more than a month.
Yep, about a month.
The reason why I ask that is because the relationship between the two of them is just forming. Trust is forming. There could still be time in which we get buy-in so that we can show that we can collaborate. There could still be time where this policy is not going to go into effect, even if it gets voted in tomorrow. It's not going to go into effect immediately. There's still, we have to get unitary status before this can even begin, if that were the case, if we get unitary status. The assumption is that all goes well, we will attain unitary status. But if we do not, this will be mute until such time, and then this can go into effect. So there's really no rush. It's not like we need this to be effective next week, next month. We still have a little bit of time to work with them, to work, I agree, to get the community involved, to get community input on this. So I just don't think that there is an immediate rush. I think that we can wait a little bit. It is created, it's not changing, it's still here. But I would definitely support that at this point.
Can I make a suggestion? Perhaps, since rather than take up a whole lot more time with this now, we keep it on the agenda. If a board member wants to move it to action for further discussion and a vote, we do it. We have that discussion then. But I don't know that we're going to resolve it here or more conversation is going to be productive. I think we just need to move it to a vote this evening.
Hear ye, hear ye.
Can I ask a question that I probably know the answer to. But getting to the point where you all thought that there was some agreement, and then all of a sudden, the NAACP decided that they did not want to be referenced in the policy. What happened? Because the substance of the policy, whether the NAACP is referenced in it or not, is the same policy, basically. I mean, you can tweak a word here or there, it's broader and all that. But I guess what I don't understand is, I mean, I can guess, but what I don't understand is why all of a sudden, something that seemed to be going along swimmingly, all of a sudden they don't want, is it because it strengthens our argument for unitary status and they don't think that we deserve unitary status? I mean, I guess that's what's frustrating to me. And maybe there's not an answer and maybe it's not even appropriate to offer one, but.
Through the chair, I would agree. It's probably not appropriate to offer one.
Okay. All right. End of discussion. Next item.
So our next item is the topic of the evening. I do have a presentation as discussed individually as well in Facebook Live. I would bring an update to the school board after our 10th day of school regarding the mitigation strategies as related to COVID-19. So what I've done is updated a presentation that I've given a few times with the most up-to-date information. And I can tell you from Friday to today, there has been a significant number of cases reported. There has been a significant number of variables that have been added to the process in which we're tracking and monitoring cases. So I'll go through from a county perspective and then work our way down to here in the school district of Indian River County. This is the CDC information data tracker that we are monitoring. This is really the only data points that we are producing in order to ensure consistency and delivering of information. You can see cases this past week was an increase of 16.01. That's an increase from the previous week. Now that number or percent increase is reducing each week moving forward, so that is a positive sign. If you were to look at the state total cases, it actually decreased this past week, so that's also a good sign. Then you look at the rest, new hospital admissions, percent of beds used and percent of ICU beds used, it's at 67%. That is alarming. Had a number of conversations, continue to have conversations with our local pediatricians, with Cleveland Clinic. They are on high alert. They are extremely concerned with what they're seeing and the entities in which they lead or the services of health that they provide to our community. You can see here, this is our dashboard. I'm sure all of you check it. I check it first thing in the morning. It updates every morning at 5:31. And what we've done is ensure that we're being consistent in how we're sharing this information across the districts. Now, you can see here, and this is the current one from this morning. So the first thing I want to draw your attention to is we are now trying to keep ahead of it by conducting cases and working quarantines on the weekend. So 8/22 was a Sunday. Wanting to stay ahead of it, we worked cases on Sunday. And then we came back yesterday, there were 25 student cases. Now, if you looked at 8/23, 11 cases, that's 11 positives. We sent 54 staff on Monday morning to be tested. At the end of the business day, we only had 14 results. So obviously what we had available.
14 positive.
I'm sorry?
14 positive results.
No, 11 results. So 11 were positive. The remaining 3 were not. And when you look at the information current as of today, we had about 21 positives yesterday. So what that means is we started our morning with 10 cases with the health department as it relates to making sure that we have those places in place. So what you see here is how we're tracking the information. I'm going to talk through some new initiatives that we're doing in a minute. This is the Treasure Coast. I wanted to draw some comparisons in regards to how it is going. Obviously, we are the smallest on the Treasure Coast. If you look at the percent of students positives between the immediate Treasure Coast, Indian River, St. Lucie, and Martin, very comparable in terms of student population percent positive. Now, my concern grows significantly when you look at positive staff. Indian River County, 74, Martin County, about 3,000 more students than us, only has 28 staff positive. St. Lucie is more than 3 times larger than us and has only 103 compared to our 74. That is concerning. Then when you look at our percent positive, this is all staff. It's 3.39 in comparison to those other 2 counties. Looking at Brevard, you see some similar numbers in comparison to us. I look at what Martin County is doing. They have an optional for all program in place. I look at what St. Lucie is doing, their program in terms of opting out. The only variance there is theirs is a mandatory for students with the ability to opt out following the same procedures that we have in place. They do have a requirement for faculty and staff to wear face coverings. So when I looked at this data and I looked at my ability to continue to keep schools open, I immediately worked with our 2 unions. We impact bargained yesterday and this morning, and now we are moving to a requirement for all staff to be face masks when social distancing isn't possible indoors. The teachers union and non-bargaining units were notified yesterday, and we just signed off with CWA, and we'll be notifying them today. That is an additional mitigation strategy that I took in order to ensure that we could slow down the spread in schools so we are not faced with closing classrooms, closing schools, or closing grade levels. When you look at our total percent of positive cases, right now it's about just under 3.5% of instructional staff. So of that 74, when you dig a little bit deeper, it's about 3.5%, very similar to what you see here, that's been reported to the health department. We can make that work, but you hear me talk about data and numbers all the time. If we continue to, as is, and we don't hit the peak and it starts to go down, or the additional mitigation strategy of requiring masks to be worn by faculty and staff slows down the spread, you can fully expect to receive communications from me where classrooms will be closed, grade levels will be closed, and schools will be closed. And I would anticipate that, just a simple projection following as we come back from Labor Day. Something has to give. So I did add that mitigation strategy. Now, I'm hopeful because in speaking to other counties that now have that same thing in place. So as an example, face covering wearing by students, you've heard me say at the beginning of the school year, it was relatively good. It was 50% in our high schools, 60, 70% in our middle schools, and 80% in our elementary schools. That number took a dive over the course of the first 9 days of school. And it was probably an average of 20% actually wearing, yet you've seen and heard me report that about 20% have chosen to opt out. So the opt-out, which is about 20% of parents saying, I'm going to opt out. So therefore, I should see 80% of our students while in classrooms when social distancing isn't possible wearing a mask. Not outside, not at lunch, not at PE, not in the movement of hallways, while they're indoors and can't socially distance. That has not been the practice. So hopefully with what I have done, increasing the expectation, providing the requirement that staff wears the face covering, modeling that particular practice, we would see an increase in the students engaging in the mask wearing because they have not opted out. This is the quarantining structure. This is the process that was provided by the Florida Health Department as a result of the governor's executive order in which he asked the 2 entities, the Department of Health and the school board, not the school board, the Department of Education to work together to provide clarity to districts regarding quarantining. This is what we're following. We follow it to a T. We're very clinical in doing so, and we will continue to do that as quickly as possible. These are the current strategies that are in place. Face coverings are highly recommended for students with an opt-out. That is still in place. All employees, this is a new one, are required to wear face coverings indoors when social distancing is not possible unless they have a medical exemption. And we will provide the leniency, and employees have already been notified, a level of leniency in order to obtain that notification with the appropriate medical professionals. This is currently what's in place. I do want to go back to our dashboard quickly. So, as we all have learned, COVID is, in the response to COVID, is a ever-moving target. So home tests are now available, and it is a choice for families to quickly access and know what's going on with either themselves as an employee or their children. Prior to this weekend, we had about 8 home tests, and the direction under the leadership of Mr. Bass was make sure, as we are notified, we ask those families to notify the health department so the appropriate process could be taking place. Walking back in between today and this morning, we got a notification about 35 home tests, 35 positive home tests. I need to modify the board to ensure that I'm capturing those students. It is a home test, but I want to be as transparent could be. We've also learned that us asking families to notify the health department, they don't work those cases because it is a home test. I feel obligated because I know to let those students know who were in close contact. I won't quarantine them, but I will give them that information that your son or daughter has been in close contact with someone who had a home test. And if they want to monitor for symptoms, they have that right. If they want to allow their child to stay home, they have that right. We'll provide that work to them. So I just don't think it would be the right move of me to have that information and say, well, because the health department doesn't do anything, I feel obligated just to make that notification so parents can make an informed decision with what they are doing with their children. We are experiencing some new concerns in this last slide, and we are managing and leveraging through this as best we can. Significant lower number of students not wearing face coverings. I think I've covered that. I am hoping with what I just did, as mentioned, that will have an uptick. We do have flare-ups. We had issues at Beachland Elementary School. We went into the weekend with 4 teachers known to be positive, and then Sunday night, while we were working quarantines, we had to rearrange staff because there was an additional 3 or 4 positive cases there. So it's up to 10 staff at that particular school. The students are that number is lower. We had, in order to be safe and secure, we deployed Mr. Myers' team there just to ensure that we had everything covered and quality instruction was taking place. Obviously, Mr. Myers' teams are quality instructors because they're the teachers of teachers. So we felt comfortable with that. But in complete transparency, Citrus Elementary is using all of its support staff, its instructional coaches, media specialists to cover classes. Treasure Coast Elementary, very similar situation. So small flare-ups, high percent of staff in those particular schools. Now, what we've realized just late last night and into this morning, as we reviewed attendance, parents who hear this information or they get the call have more concern than they had last year based on their understanding of this variant or whatever we choose to call it. So we have about, and I'm sorry, I'm going to refer to my notes. First time I had to look at them. About 24% of students were absent at Beachland yesterday, not because they had COVID, not because they had a home test, not because they were quarantined, but because parents said, I'm just not comfortable. And it's very similar at Treasure Coast, where it was 26%. So parents are making decisions that that they believe is in the best interest of their children, and we want to support that, not to bring their students based on what we currently have in place, which are those conditions, the mitigation strategies that we have in place. So those are the things that we have done. I wanted to pause right here and provide the opportunity for the board to provide feedback. This is a difficult conversation, and this is complex because I've had the opportunity to speak to each of you individually. I have a understanding as to where each of you stand, and we all don't stand on the same island here. So as you engage in this conversation, I would just encourage you, respectful, best interests of children. You guys have really modeled over the last month what that looks like. I can tell you from my perspective, job number one, free and appropriate public education, the current mitigation strategies that we're implementing. I am at high alert as to whether, if things don't change in terms of the spread of COVID-19, we will see closures, we will see classrooms, grade levels closing. So with that, I'll turn it back over to the chair.
All right, Mrs. Berenborg, why don't you go first?
Thank you. Okay, so we have had, I can't even count how many emails on this topic for the last year, and we continue to get them. And I appreciate everybody's wonderful fact-finding and research that they have out there. But I'm going to tell you, I have always gone back to what is it that we were asked to do at the beginning here. And that is that we follow CDC guidelines, and we look to direction from the two entities that we answer to, which is the Department of Education and the State Board, okay? So when we went through all this at the very beginning, and we were worried about this pandemic, we were in the Alpha variant. I don't know if you knew that was the first variant, that's what it was called. And nobody knew what we were getting into. We were presented with the fact of, do we want to keep schools open or not? And in order to keep schools open, we had to mask all children. What we didn't know, and what we learned over the time of a whole year of doing that, is that there were other factors to consider for children. And that is some respiratory issues, depression, lots of different things to factor. So this is not an easy decision. When people say it's easy, just put masks on kids or don't let kids have masks, it's an easy decision. It is not. And that is because there are other factors to consider. So loving research and looking at data and scientific data, I looked at the entities that involve us right now, and that is our local hospital, so two of them, and CDC recommendations, DOE, and State Board. So as I looked at that, I discovered some things that I didn't know already, which is kind of interesting because, you know, not that we can know it all, but there's information that's out there that if you dig deep enough, you'll find some research that somebody won't throw at you because it doesn't fit their narrative. So I'm going to tell you that I called several places around at Cleveland Clinic, and the reason why I say that is because I was put forward to lots of different groups and entities, and nobody would answer my questions. So I finally got the answer from the Director of Communications, Scott Samples. He talked to me last night, which I appreciate. So I've asked a couple of questions I can't get answers to. Number one, this community, since I've lived here in 1989 is when I moved here, how many beds have grown since that time? Because we're sitting there worrying about our hospital beds, and yet our population is just exploding, and have we really increased number of hospital beds for our population? The answer I got was, now we don't expand as much because more things are outpatient. Well, they're talking about surgeries. I'm talking about when you have something like this, when you have a sickness or a virus or, you know, whatever, or a disaster. Can we, you know, nobody really talked about, is our hospital growing with us? So that's number one. I asked whether or not, how many kids are sick right now with COVID in the hospital? I couldn't get an answer. I asked how many kids have died from COVID in our hospital. I couldn't get an answer. He's getting that for me. They don't have a dashboard at Cleveland Clinic, but they're developing one. So hopefully we'll get that information soon. I asked about ICU numbers. What are they today? What were they yesterday? So I did get a little bit of that information, which is kind of interesting, but it changes all the time, and he couldn't answer that, of course, after hours. But he did say that the 5th floor has been converted to a COVID floor, and now the 3rd floor. So they've expanded the COVID unit. But again, not how many people are on ventilators, that sort of thing. And I'm sure that information's out there, but it changes constantly. Another person that emailed us told us about a refrigerator truck that is supposed to keep bodies. And I'm going to say that just the way it is. That refrigerator truck was rented back in the height of the pandemic. It has never been used. So whoever is writing that to us and telling us that they're putting bodies into it, it's not correct. Okay, it's never been used. It is sitting there because they rented it. There are 4 visitation levels in a hospital. Yes, they're on alert high, but visitation means in the beginning of this, remember when people were going into the hospital with COVID, they weren't letting anybody visit them. That was purple. That's what they call that. We're down to red now. And it was down to orange in June, but it's gone back up to red. Red means that one person can visit and stay with a person, that sort of thing. You can go on their website to see that. So he was informative, but couldn't give me all the answers. And the one thing he did tell me, which was a little concerning, a lot concerning, was he did say as of yesterday, there were 27 in the ICU and 96 COVID patients. Now that changes, like he said, hourly. But the concern I had was how much oxygen is available. And there's only 3 days of oxygen right now available. So then they're going to get to the point of who gets oxygen, who doesn't. So that's kind of scary. There were 110 COVID patients last week, and there's 96 now. So he said people do recover, and they do leave the hospital. The Delta variant, which is the one we're dealing with now, a lot of people say there's no test for the Delta variant. There is. They just choose to not test every single person. That's what he told me because of the cost and also the efficiency of it. So it is more transmittable and to younger patients. More children around the state are getting it, but I couldn't get an answer about here. So there are a couple of doctors that are putting information out there as well from Cleveland Clinic that you can look at. I guess Dr. Nancy Baker put stuff on her Facebook page, Dr. Mike Benazio, and Dr. George Mitchell. Those are 3 that I was given names to that are putting information out. Sebastian had 33 patients and was up to 45 patients at one point. In the hospital census, as of Friday, Sebastian had 33 out of 80 of their beds being used, so they do have room. Indian River had 95 out of 237, so they were at 40%, 41%. I think that's grown a little bit since then. 90% of the people that have COVID were unvaccinated that are in the COVID unit, and 30 are on ventilators as of Friday. However, like he said, that changes day to day, hour to hour. They have converted ICU beds throughout, 5th floor and the 3rd floor being used. Oxygen's running low again. And COVID patients are now using 80% of the resources in the hospital. That is why they've gone to elective surgeries not being performed. Okay, so what else did I try to find out so that we can make a really good decision, or I can? There is, from January until now, we have doubled. Okay, so in other words, the Alpha variant was not as transmissible as the Delta variant. And so another thing that I did is I watched the hearing yesterday. I don't know if you all watched the hearing yesterday, but there was a hearing of parents that are suing the governor, and I watched the whole thing. And so it was quite interesting because the one thing that I learned from that was quite interesting was called the R0. R0 means how transmissible is the disease. So in the Alpha variant, it is R3. What that means is if you're in a room with a person that has the Alpha variant COVID, there's susceptibility rate is 3 people in that room will get it, okay? The Delta variant is 7. So it's gone up to 7 people most likely will get which means to me, they're gonna quarantine more kids. That's what I worry about. The other thing is, just to relate it to chickenpox, is 11. So remember when you were a kid, I don't know, when I was a kid, if my sister got chickenpox, guess what? I got put in the room with my sister, so I'd get chickenpox. And there was a good chance that you'd get it because it's R11, okay? So that was kind of an interesting thing I learned yesterday. That case is going to be decided by the judge possibly on Thursday. So that's information that we can also take in and look at. Some interesting things that came up in that case were studies that were brought up. Of course, when I called back in November, December, January, February, all the time I called to the governor's office and to the DOE, which was several times, I was told, follow the DOE. I called the DOE, can run around, then I'm finally told, follow CDC guidelines. So it was kind of like, okay, the governor's telling us don't mask kids, but yet his department, his office, and the DOE were telling us to follow CDC guidelines. They're still saying that. Well, the CDC guidelines have changed. So the CDC has done some studies, and that study was brought up in that court case yesterday. There were a couple of studies brought up. One, the Brown University study. Another one was the CDC study on masking. There have been several. Another one that was brought up was Dr. Bhattacharya out of Stanford, his study of masking of students, whether or not it is sufficient or not. And one of the studies was actually done in Georgia, which is really close to us, so that was kind of interesting. Now, the Dr. Bhattacharya, a Stanford study, his findings were most children do well if they get COVID, and they are unlikely to spread COVID to their families. That was his study's results. Brown University study said school districts and masked, if they did a study on school districts that masked and school districts that didn't, and they wanted to see a correlation of outbreaks in those communities where school districts either masked or they didn't. What they found was no correlation between a school district that masked and a school district that didn't mask. So there was no peer review on that, though, and that's important to note, because a peer review is something that scientists really look at to say, okay, did anybody replicate that study? So that's an important thing to look at too. But the study also was done before the Delta variant. It was done with the Alpha variant, which is R3 versus R7. Again, another thing to look at. However, at what point are we going to say, let's get back to normal? Because there's a Lambda variant coming, if you haven't heard that. So here we go again. You know, at what point are we going to say, what are we going to do to kids? Because last year, we've had so many people speak at our podium, but one of the people that made such an impact on me at the podium last year was Dr. Mark McCain. And Dr. McCain came and he said that he had treated more kids for depression and for respiratory illnesses than he ever did in his practice last year. And that's because we had kids with masks on almost all day long if they couldn't socially distance, which a lot of our classrooms they couldn't. And so because of this, of course we got an uproar of parents. And little kids who are scared, and little kids that don't get to see their teacher forming with their mouth, you know, the sounds and the phonemes. That's what we are here to do, is teach. And so we need to keep that in mind too, that, you know, that's why kids come to school. I'm concerned about the home testing, and I'll tell you why. I don't think they're very reliable, unless they've improved them a heck of a lot. I have a personal family member that had a positive home test and then went and got 2 negative tests done. So, not sure if that's reliable. I will say on the first day of school, I walked with you, Dr. Moore, and thank you for showing people exactly what the best thing to do, which is what the CDC recommends, was they recommend that you mask when you're close to somebody. And when you're separated 6 feet like we are, you can unmask. The one study that was interesting, that was noted in the lawsuit, was that the best, and that is, by the way, I'll tell you what it is so people that want to look it up can see it. It's a CDC study that was done on masking from May 21st. It's the one that the governor has mentioned before. And what they found in this was that the incidence of COVID was lowered in the schools where teachers and staff members were masked, and improved ventilation was done in the schools, which we've done, filtering and cleaning and all that. So those were the best That's what this study showed. It didn't say necessarily the kids be masked, it said the adults should be masked. So that was quite an interesting study that the CDC did. That's why the CDC is recommending masking, okay? Dr. Moore, thank you for showing people that when we masked when we went in classrooms, when we were close to kids, when we went outside, we took our masks off and so on. Get those mask breaks, same thing for kids. That's what we asked for last year, but we didn't get it as much because kids were in classrooms all day, and people, let's face it, our teachers were nervous about, if they were going to catch it. Now, people have been able to get vaccinated that want to get vaccinated. Quarantines. So last year, we had the option to have virtual education, and it was paid for because we were under an emergency order, correct?
Correct.
And we don't have that this year.
Correct.
And that is why this is frustrating. We have seen our virtual education population growing, right? But we're not going to get the funding out of that like we got last year.
So through the chair, it hasn't grown significantly. As you know, there's statutes.
155 as of yesterday, or?
Yeah, but it's only grown like 48 kids since the beginning of schools. So it's
Okay.
going into the first week when we opened it back up.
What my concern is when a child gets quarantined, again, what are we doing for those kids to educate them when they're home? I don't think the quarantines are as long as they were at the beginning last year. They were, 14 days?
Through the chair, so the guidance provided by the health department as a result of the executive order, you are quarantined for 4 days, in which on that 4th day, you can take a test. If it's negative, you can return on the 5th. If you do not take a test on that 7th day, no symptoms, you can return. Prior to that guidance being provided, it would have been a straight 14 days returning on the 15th for us. So a typical quarantine, always with 2 days off because of the weekend, should not exceed 5 instructional days.
Okay, so one thing we're going to talk about is our legislative platform. One thing I would like to ask for is for virtual education dollars to get put back in for when kids are quarantined. And so we're not under emergency order. And that was part of why we did all that last year, because we were under an emergency order. And so that kind of option and that money has been not in the equation this year.
Right, and just one point of clarity, the instructional models that we provided were the transitional, where we initially asked for that 9-week commitment, and then the typical virtual model, which was a semester commitment. You are correct, that was provided because there was executive orders in place that waived state board rule and statute to allow us to receive full funding for that. That level of flexibility has not been provided through executive orders. They expired and they have not been renewed. So we're not able to provide those particular environments. Those 48 kids that have gone to virtual, I made the decision to extend that deadline. We're losing approximately 80% of the FTE for those kids when you look at the cost that we have to pay, as well as the truncated FTE that we do not receive. Transportation, obviously, they're not being transported. Class size, they're not part of class size. We don't receive that particular funding. So that flexibility provided by us comes at a cost. It's also a semester-long process. So students start and finish within a semester regardless of when they start. So my information pushed out to the community last week, if you're going to make that decision, now would be the time. So it's not the opportunity to flow into and pick up. Now, I can tell you that our teachers have gone above and beyond as they did all of last year, and their excitement and energy going into the school year was at an all-time high. And my heart breaks for them for what they're dealing with right now. And truth be told, same for administrators and you all too as board members. But we do have the lessons available on Canvas. There are teachers who go above and beyond, and they're continuing to push out that work and communicate. We have, what was it called, Mr. Bass, Land Shark or? Land School, which is the opportunity for, educators know what it is. You have the opportunity to see what's going on a student's computer as they work. Some teachers are taking access to that. So that work is there. We instituted immediately the instructional advocates. The instructional advocates is something that Mr. Meyer's team created last year. It is a point of contact that is reaching out to those who are quarantined, not waiting for the call or not waiting for a parent to be frustrated, but saying, do you need to be connected with a teacher? Is there additional information? How are things going? So that's a proactive approach. And we provide communication that says it goes all the way to Mr. Meyer. If you're not getting what you need while you're on that quarantine, please reach out to us so we're able to make sure that you have that information, and we are being proactive in reaching out. So we have those systems in place. As I said, quarantines about 5 days. So those systems are in place, and we'll continue to look at them, because as quarantines continue to grow, or students who are not quarantined, but they are in fact positive, so they're out for 10 days. So really working with our teachers to determine, are there more effective ways to provide long-term instruction for those particular kids? And truth be told, that is a major hit academically. And the data that I've shared with this board, both in community, is our sweet spot is classrooms with teachers and students in them. The data is abundantly clear. We do amazing work with those students in that environment. Those virtual and transitional models, they work for some, but they don't work for all. And, you know, this is impacting kids across the board. Our cases that we're seeing are very spread out. So the 24 cases that we had yesterday impacted 11 different schools. So it's not one particular school that we saw yesterday, but it is spread out. So those are issues that we continue to problem solve.
Okay, and there are some other things to consider. First of all, you know, a lot of people have said it's the vocal few that are against mask wearing. However, if that's the case, then we'd have a lot more kids wearing masks in schools. So that's the other concern that I have is that, you know, some people think that, but where's the proof in the pudding? Proof in the pudding is how many kids are putting masks on when they're in school. So we also have a new law, the Parents' Bill of Rights, that we need to consider. And parents have rights, and parents need to be able to make decisions for their children. And, you know, we were criticized a lot last year because we were taking, you know, we were going beyond our education scale and going into practicing medicine. That's one of the things that people said we were doing. I'm not saying that we did. I'm saying that that was an argument. One thing that I see, but numbers don't lie, if you look at what you showed us a little while ago in Indian River versus Martin County versus St. Lucie, on those different dashboards, you'll notice that St. Lucie, even though they're 3 times our population, they only have, what, 2 times the numbers? It looks like? Okay. So I walked on a St. Lucie school campus yesterday, and I asked the administrator how many kids are wearing the masks, because they have mandatory masking with an opt-out. Very similar to ours. Ours is strongly recommend with an opt-out. Pretty much the same thing, right? They have 20% of their kids not wearing masks. So 1/5. Every 5th kid is not wearing a mask, okay? Which is what we thought we were going to have, correct?
That was the hope.
With the numbers that have checked opt-out. Their numbers are under control as far as being able to handle what's happening in their community with their hospital rate and everything else. And again, lots of studies are showing that maybe there's a correlation, maybe there's not, in masking children versus whether or not you're controlling things. Yet a lot of doctors that I watched also, the Friday afternoon, there was a, if you haven't seen this, board members, there was a Cleveland Clinic presentation done. I watched that whole thing, and you know, that scares you, because that's our community and what's happening with the beds and what's happening with the oxygen. And you know, doctors are going to say, you know, this is affecting us, and they see it from that point of view, so they're going to say everybody should mask. I get that. We're looking at it from a different perspective. We're looking at it of, you know, is it really going to help the community? Is it really going to help our kids? Is it going to do that? You know, people are saying kids are dying, but is that happening here? So I like the fact that I'm looking at what St. Lucie put in, which is mandatory masking with an opt-out for parents. Now, how do you control that versus strongly recommend versus opt-out for parents? If we don't provide an opt-out, we're going against the law. And that's what several districts have gotten in trouble for, and there's a court case right now that will be decided on Thursday about that. So the question is, and we've been asked to go against the law. A lot of people have asked us to do that.
So I'll ask, you said law, I look at Suzanne. And that is the dilemma. So throughout your presentation, extremely thorough, by the way, you mentioned a number of times following CDC recommendations. We are not following CDC recommendations. We are pit against the CDC recommendation, which is wearing the mask while indoors, versus the executive order, which requires the opportunity for parents to opt out. That is the dilemma. The local decision-making that this school board has been called into question or removed from you in some ways with the threat or consequences of removing 1/12 of each board member who would vote positive for some kind of mask requirement that did not have the parental opt-out option. And that 2 districts, Alachua and Broward, are in the midst of that. There are a number of additional requirements and logistical things that I would have to do if that was a decision made by this board. But that is, I'd ask Susan kind of to weigh in on some of the legality questions the board would have regarding making the decision of requiring masking and breaking the law, going against the executive order. Just feedback there, please.
Absolutely. And if there's a specific question, I mean, I'm happy to get specific, but I'll just take it from a very broad perspective. As we all know, the governor passed his executive order directing both the Department of Health and the Department of Education to adopt emergency rules. That executive order doesn't really direct a school board to do anything. It's directed at some state agencies. So to the extent anyone is telling you that you would be in violation of the executive order, the most recent one that was passed by the governor, that particular executive order doesn't speak to school boards. It directs state agencies to do something. Now, those state agencies have done that. The Department of Education passed 2 emergency policies that don't really touch upon the issue of face coverings. The Department of Health did pass a rule, an emergency rule, so let's be clear that doesn't go on forever. Emergency rules are for 90 days and no more unless the agency takes action to extend formal rulemaking and to actually adopt it as a formal rule. So we're under an emergency rule, which is temporary. It's the same, we have the same ability. If we want to pass an emergency rule, it's a short-term rule. So the rule passed by the Department of Health touches on a lot of different topics with regard to COVID. One of the items it speaks to is students having a mask requirement, and if that is done in a school setting, that the parent is supposed to have an opt-out. That particular sentence doesn't provide a lot of detail as to what that means. We are all interpreting what a parental opt-out means. Is it as simple as on a plain piece of paper writing opt-out and handing it in, or is it as detailed as what the Department of Health typically does in some of its other rulemaking, where there is a form, there are boxes, there are doctor sign-offs for vaccinations, there are all sorts of parental sign-offs, and you have to answer all these questions. That part is unknown. I'll be the first to tell you, I don't know. The language in the emergency rule is just that. It's one sentence with no detail. And what you may be hearing from other parts of the state with other districts, other school boards, is they are interpreting that language to mean that as long as there is some ability to follow an opt-out process, that they are in compliance with the Department of Health rule. What that opt-out criteria is at this point, I mean, we're looking at 8 different school boards at the moment who have different versions of a mandatory face covering requirement for students with some sort of opt-out. Is it a carte blanche, whatever you want to do, you can opt out, or does it include medical sign-off, or if it's a religious exemption, is there some sort of a religious leader sign-off, or is there some other information that has to be provided? That is the question around the state. At this moment, I've not seen guidance issued by the Department of Health, and we've not seen any type of rulemaking with regard to the form to be used for this opt-out, which is what the Department of Health has done in the past. So that's an open question. At the moment, we have 2 school boards who have kind of a little gotten through the process with the State Board of Education with regard to an allegation that they have violated the Department of Health rule. All right, we're talking about Alachua and Broward. Both of those school boards have received orders from the State Board of Education claiming that they are in violation, and that under a statutory provision, the State Board of Education has the ability to withhold funding. And the order that I have reviewed for the Broward School Board, the funding that the State Board of Education is directing be withheld from the Broward School Board is essentially the monthly salary amount for school board members in that school district. The order goes on to say that there may be other consequences. We don't know. The order goes on to say that there are now reporting requirements for that school board, which will go on into the future, and there may be more than what's outlined in this particular order. I understand that the school board is going to legally challenge that order. I've not seen that petition or whatever is going to be filed, but I understand that they're going to legally challenge that decision because they believe that they are in compliance with the Department of Health rule. If something like this were to be discussed and passed in Indian River, I think you could look for the same type of action to be taken by the State Board of Education. I've not heard anything about anyone backing down. It could entail being requested to attend a meeting in Tallahassee to speak to the State Board of Education. It could require data reporting or other information to be shared or a response to any type of allegation that a board has violated a rule. So you would expect, if this continues to happen in other districts, that all 8 of these school boards that are on the list that have a mandatory mask for students with a medical or some other narrow opt-out, you would anticipate that they will all receive the same type of letters and orders from the State Board of Education. Whether they will be upheld, I can't tell you the outcome of the litigation that's going on today, tomorrow. Hopefully we'll get a decision this week. There are other legal challenges that have also been filed. The NAACP, the statewide NAACP, filed a challenge to the Department of Health rule. It's a very narrow, very technical legal argument. It has been filed to the 4th District Court of Appeal, which governs over Indian River as well as Palm Beach. Perhaps there will be some sort of a ruling in that case that will be informative. We don't know. It'll be probably a week to 10 days to 2 weeks before we see anything coming out of that. Another item, I just want to be sure that you're aware, another item that has been mentioned, but I've not seen anything more about it, is the governor declaring that he may remove school board members that are not in compliance with the Department of Health rule. Under the Florida Constitution, the governor does have the authority to remove an elected or appointed school board member, as well as some other officials, it's not just you, has the authority if the criteria in the Constitution are met. And if that were, and he has done that. Governor DeSantis has suspended elected board members and an elected superintendent, to my memory, since he took office. The process to challenge is a hearing in front of the Senate. And then the Senate makes a decision, and then it goes from there. So there are other possible consequences out there. We don't know if the governor will go to that extent. We simply don't know, but that has been mentioned, I know, at least in one media report. The final issue that I will just mention is under the statute that authorizes the State Board of Education to financially challenge or financially sanction a school board. The statute, it doesn't give a lot of detail as far as the process. We don't know what the process looks like. Broward and Alachua are seeing it for themselves firsthand, and we are all watching to see what this process looks like. But that statute does say that in order to financially sanction a school board, it has to be based on either a violation of the law or a violation of a state board rule. I don't know how a judge will come down on this, but I raise it because I want to be sure that we have all the information. We need a law or a state board rule. So the Department of Health emergency rule is a Department of Health emergency rule. So that, to me anyway, doesn't fit within the statutory provisions requiring a violation of a state board rule. So we are then left with a violation of the law. And I know everyone is pointing to the Parental Bill of Rights as the law that may be violated. The Parental Bill of Rights does not contain the phrase face covering. It does not. I've looked. The Parental Bill of Rights contains language about making decisions about medical care. A parental right to make decisions about medical care. And that in Tallahassee, in the geographic area of courts that govern Tallahassee, it's the first District Court of Appeal, the first District Court of Appeal. That court held, with regard to the Alachua School Board, that a face covering is considered making a medical decision. However, there are lots of school districts not under the jurisdiction of the first District Court of Appeal. The other court in the state of Florida, there aren't many, the other court in the state of Florida that made a decision on this issue is the number four, District Court of Appeal, which is the appellate court with jurisdiction over Indian River. And that court, in a case involving a county, Palm Beach County, not a school board, Palm Beach County, and its mask ordinance, and this dates back to last year, 2020, the beginning of 2020, when Palm Beach County passed their mask ordinance, and it went through the court system and got to the fourth District Court of Appeal. That court held a face mask was not considered making a medical decision. So at the moment, we have a conflict between two appellate courts, and the only tiebreaker is the Florida Supreme Court at this point. There's nothing pending in front of the Florida Supreme Court. So from the lawyer, the geeky lawyer perspective, the fourth District Court of Appeal has made a decision that a face covering is not considered making a medical decision. Therefore, those face covering ordinances in all of the geographic areas governed by the fourth District Court of Appeal can continue forward. You may recall this school board was sued by some parents with regard to your mask policy and implementation last school year. And we have a circuit court order. So it only governs Indian River, at least on the facts of that case, which held that a face covering was not considered making a medical decision. So what a mishmash of a lot of differences across the state. But these are unprecedented times, as they say. And the processes that you are seeing across the state with regard to the governor and the Department of Health implementing what they believe to be the state policy versus local school boards implementing what they believe to be the appropriate local policy, we are going to be seeing brand-new laws created by the court decisions that come out of this. But the documents in front of us at times are not clear, and they are subject to multiple interpretations.
Thank you. You did cover what I said was the law, which is Parents' Bill of Rights. It is very gray, and that's why this is a difficult decision. I go back to studies. There are studies that the CDC has done that say recommending masking. There are studies that they've done saying masking in correlation to an outbreak in a community doesn't show correlation. So the CDC is also confused about what's best, I think. So how are we supposed to know what's best if the CDC is also who we're supposed to look to and they have conflicting research? So Dr. Moore, you mentioned that we're not following CDC, but it does say that CDC recommends in universal indoor masking when 3 feet, right? It's not allowable, which is what we did last year. I'd be comfortable with moving up to what St. Lucie did, which is asking for mandatory masking with an opt-out, okay? Now, I think the difference in that versus what we're doing right now, because that's a step up towards seeing what we can do to help our community. The difference, I think, in that is that a parent actually has to fill out a form or click it or however they want to do that, and that form goes in and the administrator knows, okay, I have a form on this child's not coming with a mask, so I need to have that child either fill out the form or wear the mask. I don't know if we're doing that. Are we doing that?
Through the chair, we're having the information sent in. Now, taking that as a mandatory opt-out, that would be the next step.
The other thing they're doing that's different than us is they're insisting that their employees are wearing masks. So I appreciate that, because I will say, even in the study with the CDC, that it's not showing correlation between students wearing masks and the community outbreak. They did see a correlation between the staff members wearing a mask and community outbreak. So I think that's a really great step forward as well. At that time, I just thank you for allowing me this much time that I normally don't take, but I felt like it was important that I'm sure other members have done similar homework, but I think it's important that we share this homework because this is the time to do it.
All right. Very comprehensive, thank you. Mrs. Rosario?
Thank you. I have a question. How many employees do we have in the entire district?
Through the chair, we have got, you caught me at a blank there, Ms. Rosario.
Sorry, even approximate.
2,200, 1,250 are instructional. Nope,
2,200,
nope, sorry, 1,700 total.
Say that again?
Let me get that number for you.
yeah. I sent an email requesting this information, and I think that as soon as you get it, if you can share that. Dr. Moore, the numbers that you put up on that screen in terms of COVID positive and those who were tested, can we put that back up there, please? Yeah, I think that's it. Okay. To the left, we have student cases. To the right, we have staff. But how many of those are teachers versus other?
There are 51 teachers who are positive.
So of the 103, you mentioned 103 earlier, which is different from what's on that screen. What's on that
103 was
screen
yesterday.
says
This is
74 positive cases.
103 was yesterday. This is the snapshot when we began the PowerPoint, and this is the updated as of today. So that
Okay,
was the
so
growth of the 25.
74 So 74 staff, and of the 74, 51 are teachers?
Instructional staff, yes.
51 are instructional staff. And everyone else is other.
Other, correct.
Anyone other than in classroom?
A non-certified teacher is probably the best way of saying that.
Okay.
Through the chair,
And-
Mr. Zario, 2,100 employees.
Okay, so we have 2,100
first.
employees. How many teachers?
11:45.
1145, and then other is everyone else. The difference would be
Yeah.
everyone else, okay. Thank you. I have had questions about the variant, right, Delta variant. And for quite a while, you all know that I was sick in July, and I lost my sense of taste, not my smell, my taste. I went to get 2 COVID tests. They both came back negative. And so it started to raise some concerns for me in terms of the test. So I do question the home tests that are being sent out. I wonder, and I'm just throwing this out there, I wonder how effective it is and how many of those who are taking the home tests are positive versus negative, and it's just a curious thing for me because we don't want false negatives and we don't want false positives either. So to get accurate data is very important. So after I was sick, I started to wonder, and I inquired about my test results. Did my test results show this Delta variant? Because I thought maybe I had got the Delta variant, and somehow or another it just didn't show in the test that I was given. So I've been doing some research on that. I called Cleveland Clinic, I called Martin Memorial, I called Duval Health Department, I called Indian River Health Department. I've called a couple of others, but you're on hold for forever, and of course I hung up. Every single one of them say the same thing. The COVID test is the COVID test is the COVID test. The COVID test does not test for any variants. So you don't know if you get the Delta variant or the Alpha or the Beta, the Gamma, all of the Greek alphabet, you have no idea. COVID is COVID is COVID. When you have the flu versus a pneumonia, you get a test for the flu, you get a test for the pneumonia, and you can actually get a diagnosis for both. In this particular case, there is no test for the Delta variant. So I went on the CDC website. The CDC website has been looking at this Delta variant since last year. There is no data. There's no data. They say it's very contagious. They say there is something called genomic surveillance, and that through genomic surveillance, they can detect or monitor the Delta variant. But when you go on the genomic surveillance information on the CDC website, there's nothing there. There's nothing that talks about the variants. It's just a lot of fluff. It's a lot of fluff for something that's not, we're not seeing numbers. We're not seeing, so local hospitals are saying, for example, and I'm not trying to negate the fact that, that people are getting sick or that hospitals aren't filling up. I'm not trying to say that. What I'm suggesting is we're not getting the right information. That is for sure. Because if hospitals are, and I saw that, that news, Terry, I saw the Martin Memorial and Indian River County had a press conference on this. I saw, what I heard was that the Delta variant is very contagious and that patients coming in with the Delta are getting more sick than the previous variants, in a nutshell. But there's no data. They don't have any facts to back that up. So when I called and I asked every single one of these for more information, what I was told was, we're just assuming that you have the Delta variant. That's not good enough for me. That is not good enough for me to make a decision. I'm a data person. I want to see the numbers. I want to see how these numbers relate so that I can make a right decision. So as far as I am concerned at this point, COVID is COVID is COVID. Delta, Alpha, Omega, Zeta, it doesn't really matter to me. COVID is COVID is COVID. People are getting sick with COVID. Until numbers are released, until we can see those actual numbers, honestly, even in the news, it's like Delta's everywhere, but where are you getting this from? It's almost like there's a phantom variant out there that someone just named, and now all of a sudden the whole world is running with it. So there is validity to the worries in terms of the missing of data. With that being said, following the concerns with the number of people who are getting sick in our schools, I just want to be clear that we do not have data, we do not have surety, a surety, we do not know for certain that any student in our schools, as is supported by some of the studies, are actually transmitting to teachers or teachers to students. I want to be clear that we don't know that for sure, because people have lives outside of schools. People go to birthday parties. The spike is coming from everywhere because now the whole world is not in lockdown. Our charter schools are not enforcing any of the executive order, any mask mandate, anything that we are trying to be obedient to follow in terms of state board rules. Our charter schools are not doing that. There are many other charter schools across the state that are also not doing that either. So, and their numbers are not quite as high in terms of cases, or those, they're not quarantining. And so I wonder how successful some schools can be with no mandates versus those who have some kind of recommended, or those who have mandates in terms of masking, and those who opt out. That would be a great study for someone to look at schools without any mandates versus schools that do have mandates, and we'll see the difference. Locally, our charter schools are not doing that. They're not following. So I wanted to throw that out there. In terms of opt-out, some questions, there was some mention about how the opt-outs should be, that there should be, or there could be an interpretation of opting out, but you're needing to provide religious or some other exemption. I don't think we should go that route. This opt-out has nothing to do with religion. It should have nothing to do with religion. It should have nothing to do with exemption. The executive order and the DOH rule simply state parents can opt out. Simply, that's it. Nothing more, nothing less. So we should just keep it simple. You're either opting out or you're not. And I don't want us to get into the muddy waters of that. I really want us to just keep it simple. My concern is that I'm hearing a lot of students on quarantine are not getting instructional materials. How are we going to make sure that that's the case? That that's
I mean,
not the case?
if that is the case, instructional advocates will be reaching out to make sure that they have that particular work assignment. So I know as you begin to implement that there will be a implementation kind of uplifting the process, but I don't think it's going to be anything that impedes our ability to implement it as it's currently being done.
So I think that that's not what's happening, though, at the ground. There are a lot of people who are not getting materials when they go home. So maybe that we can have some plan B. Have someone call, you're home, do you have the work?
And that is what the instructional advocates are doing. So rather than waiting to say, I don't have the work, the instructional advocates are being intentional. As you can see, in comparison to other districts, our quarantines are significantly less, so it's a volume that is going to continue to grow. But right now, it is something that we're able to manage as they're dispersed across multiple campuses. So we do have those advocates making those contacts to follow up in order to ensure that work is being provided.
Okay. And how long has the district leadership been talking about asking staff to mandate masks?
So looking at the data in the Sunday evening and Monday morning that we had, and looking at what other districts were doing, and realizing that we're on a path within the next week and a half to close classrooms, close grade levels, and close schools, that was an immediate response that I took. And just looking at the numbers, what mitigation strategies can we take? And at the driving point of this conversation is the operation of schools, a free and appropriate public education, and taking the necessary steps in order to ensure that we're providing that. I have said publicly, if we were to go to a mask mandate, obviously that is a heated decision that ultimately should be made by the board. But I can't wait not to take the appropriate steps. I think Ms. Barenborg kind of referred back to her in her remarks what St. Lucie is doing. The only difference was two things. The option that we have is a recommendation versus a mandate. I think that's just a play on words.
Yeah.
And then the bigger difference is making it mandatory for staff, where the practice is actually being modeled. The information that I have is similar to what Ms. Barenborg presented. 80% are wearing versus the 20% we have, which is, it's a problem. And you could see spread in schools. You're right, Ms. Rosario, you can't say 100% where it came from, but when you have 10 teachers at Beachland, all within a window of time, it's a pretty safe assumption.
Pretty safe assumption.
That they, unless there was a beach party or a staff gathering, when you see a flare-up like that, so coordinated in terms of when students or faculty are becoming positive, we're seeing that spread in schools, the mitigation strategies not being effective.
I wouldn't say the mitigation strategies are not being effective. I would say that we're doing our best to mitigate, because in one breath, we have this plan in place to address COVID in our schools, but for us to then say that our mitigation strategies are not effective at all, I think we would just say, well, then let's toss it and start from the beginning. And I don't want us to go there. So if the schools are doing the best that they can, I think that's important to stress. I want to know why and I don't know if this is a question for Suzanne, why is it important, or what is the distinction between something that a board should vote on or a board should have consensus on versus a decision that was made, such as mandating masks for staff members? The decision to mandate masks, for staff in our school was decided yesterday. Where do we draw the line or understand when the board should make a decision like that versus a day-to-day decision, or versus the superintendent making that decision? I'm just trying to understand why it was so important for the board to be involved in the Safe at Schools plan last year and even going into this summer, and then this was not a decision that was brought to the board prior.
The initial Safe at School plan that all school districts were required to adopt, according to the Department of Education, there was an emergency rule. It may not be called an emergency. It was an order issued by Commissioner Corcoran that required all school districts to adopt a reopening plan. That specifically required board action, so it had to be. So those initial plans that covered a myriad of things had to be approved by the board, and that was in order to access funding. So that's a little different.
Okay.
Since then, different plans that have been brought to you did not necessarily require board action, in my legal opinion. Whether it is an appropriate thing to do locally for the community or because the board wished to have input into something, that's a local decision. The superintendent has the authority to direct the day-to-day operations of employees. So requiring face-covering requirements is certainly within his authority as the superintendent. There may be collective bargaining impacts that have to be negotiated with our unions, but he certainly has that authority to do so. With regard to students, it's a little more complicated depending upon what the recommendation is. For instance, we have a student code of conduct that says if you do certain things, here are the consequences, students, for your behavior, for violating this code of conduct. So if we were looking to do something that had a sanction, that would require board action. But if we are not looking to have a sanction or a consequence, then it may be well within the superintendent's authority to do certain things. And I'll also remind you that I'm not going to have the date right, but it was the summer of 2020. In the summer of 2020, the board went through some rulemaking. And one of the policies adopted during that time period was a general delegation of authority to the superintendent with regard to pandemics and epidemics. It was a broad policy that basically said that the superintendent is charged with coming up with plans to address a myriad of things. It's not detailed, it's just you have to have a plan, Mr. Superintendent, in order to address any pandemic or epidemic. So I would say that policy also gives the superintendent some authority to adopt various plans with regard to schools and employees and the operations of the district.
Thank you.
You're welcome.
For that clarity. I've had some people ask, and so it's good to talk about that publicly. I also, Dr. Moore, would ask that when a decision like this is made, especially under these circumstances, that we receive notice prior to notifying staff about it, that we just get the heads up, the courtesy of knowing this was the discussion or this is what's going to happen so that we're not blindsided. I only found out through an email on Monday, and I don't think that I should have found out through an email. I don't know about other board members, but it would just be appropriate to do that, to notify us ahead.
Okay.
Thank you.
All right. This meeting is supposed to be over at noon to be followed by master board training. In hindsight, we probably should have canceled master board training, it seems to me.
Yeah.
How do you all want to proceed? I mean, obviously, Dr. Schiff, I've got a few things to say, not a lot. I'm sure Dr. Jones. What's your pleasure in terms of, do we go till 12:30? Does that,
I was going to say 12:15 and reconsider, but if you want to do 12:30. Because Mr. Barefoot, what I do think is important, of course, it's important that we fully discuss this, but I also think it's important that we honor the time of all board members and that we be relatively succinct in our comments. I know all of us have done a lot of work and a lot of research and come to this meeting well prepared. But we have a really important decision to make. And unless we're going to cancel master board and talk about this all day long, we have to get somewhere.
Well, I completely agree with that. I just want, I don't want to have any conversation cut off because we're watching the clock. On the other hand, I want to be respectful of the people coming for master board training, and maybe if they have to wait a little bit to start that program to give us a break between finishing up here and then, that's so be it. But
Well, also, the challenge with that is that they have planned their time carefully, and then that backs us up into the next meeting. And
no,
certainly
I-
by 4 o'clock, I speak only for myself, I will certainly need a break.
yeah. Ms. Rosario?
We have, at our meeting, we have space in our agenda to move some of these items to discussion. So if some of these items could be reviewed before they come to us, C through H might be some of those items that could be moved to the business meeting instead of talking about it now, talk about it this afternoon. Or this evening, rather. That's a suggestion. And then Dr. Jones just came in. I don't know if the legislative platform is important enough for her to discuss now, or maybe that would be something that she could hold off until another meeting, so that we can move on. I don't know if canceling the master board is appropriate because we have
We
someone coming.
can't at this point, we've committed to
It's
other
not
people.
appropriate to do that.
No, I'm not suggesting cancel. I'm just asking. Well,
Yeah.
let's not spend a lot of time talking about this. Dr. Schiff, you're up.
Yeah, I'm not,
Going.
I'm not going to go for a really long time. I'm going to be as brief as possible. Suzanne, thank you for that analysis. I think that was one of the most comprehensive and thorough analyses I've heard on this really important issue. If you have that anywhere in writing, I don't know if you did, but I would love I would love a copy of it. You may not, and I understand that.
I don't have anything in writing because everything has been very fluid.
Yeah.
Actions have been very fluid.
I think, so I'll rephrase. What would be really helpful for us in making these decisions is perhaps regular updates from you as the environment changes. And I don't know if that's possible, should be possible, but as new information comes out, it would be really helpful that we can keep abreast of that from you as our counsel rather than solely from our own research and interpretation. So that's one question, that's one statement.
Just with regard to the 8 or more school boards that are challenging the authority.
Well, you just gave us a really good analysis of what's included in what laws, what policies, what we're obligated to follow, where there is interpretation, and we don't know the outcome of court cases now, clearly. So obviously, you can only tell us that they exist, but not the outcomes. But the analysis that you've done on existing laws and orders and other legal obligations would be helpful. And then I know that in the past you've been good about getting us information as soon as there is an update to some legal obligation. I know how I feel about this, but before I get to that, Dr. Moore, I want to be clear because I didn't hear it clearly in your comments. Are you recommending that the board change our policy to a mandatory mask policy? And if so, can you clarify what you're asking us specifically to consider here?
So my goal is to bring a recommendation. I just
Yeah.
wanted to afford each board member the opportunity to have discussion, and based on that discussion, I'll form what a recommendation
Okay.
would be.
So I didn't miss you saying it, it's you're waiting for the conclusion of this discussion to determine what recommendation you're going to put forward to us.
Absolutely.
Got it, okay. As other board members have mentioned, and I'm not going to belabor it, there are a lot of studies out there. There are a lot of studies that have happened at a lot of different times, as far back as 2015, before we knew the existence of COVID. We've been forwarded some of those studies. There are studies from 2020, some of which stand, some of which have been updated or repudiated either by the authors or by the editors of those. Some of them are peer-reviewed, some of them are not peer-reviewed, some of them are from legitimate sources, some of them are not. I have looked through dozens of them, and I'm not going to belabor them all here. Science emerges. It is not a static concept. So what the CDC knew or said a year ago, it's not that they don't know what they're doing, it's that it's an evolving concept. We haven't faced this before. So they're not trying to mislead us, they're not trying to pull the wool over our eyes, they're not trying to communicate some untruth so that we can all be misled into some harmful policy. They're doing the best they can, as is every doctor in this state and in this country. I'm seeing doctors walk out, I'm seeing overwhelm, and I notice that I'm getting worked up about this, so I'm going to try and back it up a little bit. As I understand it from Suzanne's comments, were we to move forward with some form of a mandate with a medical opt-out, we are not in violation of any currently existing law, policy, executive order, as long as we have an opt-out and we get to determine if that's a medical opt-out. Am I understanding that correctly?
That is one interpretation of the Department of Health regulation. I can tell you the State Board of Education does not agree with that interpretation.
Right, okay. So we have to make a decision as a board where we're going to stand on this and where we're willing to stand. As Mrs. Rosario points out, Delta, COVID, I don't care. I care that we're putting people's well-being at risk. And I don't care if it's because of Alpha COVID or Delta COVID or Lambda COVID. I care, and I am aware that things happen in the community over which we have no control. The only thing over which we have control is our district. And the only thing over which we have control is when students and adults spend whatever time it is they do in our buildings. We can't control what they do in the community. It doesn't mean that we are not subject to it or it doesn't have implications for us. But we have to make policy based on what we think is best in the context of the environment that we have any control over, and that's our schools, and that's it. To get to the bottom line without pontificating or belaboring a whole bunch of this, I'm not willing to risk kids. I'm not willing to risk one kid going into a hospital and not come out. And I realize that some people say masks don't work, but in the studies that I've seen, not one of them doesn't say, particularly now, that it's not a mitigating factor. It doesn't replace vaccination, but it mitigates risk of, what's the word? Not asphyxial. I can't think of the word I want. It mitigates the risk of exposure in the way that this disease is exposed. And I've got lots of comments here that I could read from, and I'm not doing that. But it is a mitigating factor, and there's tons of evidence on that. And it's frankly one of the ones that we have. As Dr. Moore stated earlier, we are at risk of having to close classrooms, of having to close grades, of having to close schools. I personally think it's a lot worse. I, as a parent, and as the only parent of a child in this district right now, would be far more upset than an individual child being quarantined if my entire kid's school was shut down or my entire kid's grade was shut down when he didn't appear to be at any great risk, but because of the risk in the community. There really is overwhelming evidence that masks help reduce the spread of COVID at this point. Our hospitals are getting overwhelmed. Whether they are at this moment or not, the trajectory suggests that they will be at some point. If you look at the spread in the community, if you look at what's going on not just in the district, but you look at numbers in any data source that you look at, it says we are ranging from high to severe to extreme risk. And I check 2 or 3 different sites daily on this, and I'm happy to share those with anybody. So all of that being said, I think it's important we take whatever mitigating strategies are within our control to do to protect our kids, to protect our adults, and I would be in favor, and if there were consequences, then I am willing to accept those consequences to diminish the risk of illness or potentially worse in our district. So that's more pontificating than direct evidence, but I'm happy to share direct evidence, and I'm happy to share reviewed studies, and I'm happy to share reviews of reviewed studies on what's peer-reviewed and what has been repudiated and what's been updated. But I am worried about this. I am scared to death of it, frankly. And people say, "Ooh, you know, don't be led by fear." If anything were to happen to my child or any other child in this district from which they could not recover, I'm sorry, but I don't, I'm not okay with that. I'm not okay with that. And I think a piece of cloth or a K95 mask over your face for some limited amount of time. There are innumerable masks that are comfortable, that are safe, that can, there's a lot we can do with masks, and I'm in favor of it. Dr. Jones.
Thank you, Dr. Moore, for that information that you put out with staff and teachers requiring to wear masks. I think that's a very good first step. I visited all schools within the first 9 days, and I agree with what Dr. Moore said. First week, the masks were looking pretty good. Second week, not so much. I have no specific percentage, but not as good as the first week. I have listened to both calls with the State Board of Education and the Health Department, the first one, and then the State Board of Education and the superintendents. And to be very honest, I was pretty concerned about how the superintendents were being spoken with when they were standing up for what they believed was right for their district. I talked with Dr. Peter last night about 7 p.m. He is the Chief Medical Officer at Cleveland Clinic, and I took some notes. He said at this time, positivity rate for those with symptoms is between 20 and 40% in this county. We did have the single digits in June. Dr. Moore, if you remember, into June, we were going, okay, we're going to do it. And then that changed. So we had single digit to 20 to 40%. The ICU is full with ventilators. And I just received an email from Scott Samples because I missed his call last night. 102 COVID positive patients hospitalized. By comparison, on July 2nd, that number was 6. So real growth there. He said, and this is in all studies right now, with those who are in ICU, vast majority have not been vaccinated. One thing that I did share with him, because we're always talking about things and listening to people and reading emails, is that we all know vaccinations will help. That's pretty well out there. But I said, we'll always get the information that masks do not help or they're not a deterrent. He simply said 3 words: they are wrong. He said this is not a political issue, this is a public health crisis. And obviously Florida leads the nation with that per capita now. One thing he wanted me to mention was from the American Medical Association. 96% of doctors in this nation are vaccinated. That is how much they believe in it. So he said if the community would work together with vaccination and mask, CDC inside, wear your mask if you can't social distance, that would certainly help us. And I think Ms. Berenborg mentioned all the things that Mr. Samples also said. I remember right before summer school, we were going back to not mandating masks. And I said I was okay with that as long as we continued to study it. You know, I support the American Pediatric Association. K-12 should be wearing masks. I support the CDC guidelines where we should be wearing masks inside. And again, when I went to campuses, and again, each and every one of them, and I saw the masks not so much the second week as I did the first week, I was very, very concerned. And as I look at this data in Indian River County, obviously we have some issues. I understand the executive mandate, I understand the Parents' Bill of Rights and so forth, but I am not willing to shut down classes or a school like Brevard County did. I'm not willing to lose teachers for a long time because they have COVID, and I'm not willing to risk any student with getting sick. I think it's our responsibility as a school board that we do the best we can so that we are doing everything preventative so that we do not have as many issues. We know this is a virus. It's something we cannot see, so we've got to do it. And I'd just like to end with this. I think about this all the time. I think there's a real difference between a manager and a leader. A manager will do things right, will follow the procedures, will follow the mandate, will do things right. But a leader does the right thing for our students, our parents, and our staff. And I think that's what we have to do. I'm not sure what Dr. Moore's recommendation will be, but I've seen in some counties where they're looking at when it is below a certain positivity rate, or we're looking at after 3 or 4 weeks at school, whatever it may be. But I just think as a board member, when I said I would serve in this district and serve this community, we have to do our best to keep our students and staff safe. And I understand the consequences, and I'd be willing to take them. Thank you.
Well, thank you all for all the work and effort you've put into. I learned a few things, particularly from you, Mrs. Barenborg, about, the statistics and that. This actually is a pretty easy decision for me. And it's not at all relevant on the one hand, but I spent 33 years on Wall Street managing risks for major financial institutions. And there's all sorts of different kinds of risk. And I'm not teaching a course in finance here. But this is a risk management business that we're in, this discussion we're having. And shame on us if we don't do everything we can do to mitigate the risk. This morning, and I hope she doesn't get upset if she's listening, she probably won't, I met with Shannon Bowman, Child Care Resources, and this was on another issue that I've helped them with over the years. And I asked her about COVID. One of their classrooms is closed. They expect another one to be closed. Over the weekend, with today's Tuesday, yesterday, there were 5 kids in one of those classrooms. Now, you all know they're pre-K. One of whom was diagnosed with COVID. The other 4, they're waiting from their pediatrician, no home tests, for the results of that. Her hope is they aren't, but she suspects they all are. They have a young, under 1-year-old, I forget exactly whether it was 6 months old, diagnosed with COVID. And the Parents' Bill of Rights. But the parents, and we got all these emails, I didn't count them all, but it's a good thing that I expanded the amount of capacity, or whatever you call it, gigabytes on all my equipment here. But as several have pointed out, as a matter of fact, it's been stated in some of our meetings that, well, what about my rights as a parent? My rights are to feel that when I send my child to school, they're not only going to get the best education possible, but they're going to be safe. And safe from the nutcases that run around, like down in Parkland several years ago. This is a different kind of enemy that we're facing here. And I just don't see any reason not to have mask mandates. In my discussions with Dr. Moore yesterday, if we were to do this, is this a mandate for all students, or is this through 6th grade, the 5 through 12-year-olds, because they can't yet get a vaccine? I guess that's a detail, but it seems to me that this is a very easy decision. I am personally in favor of everybody's mandated for masks, or should be, unless they opt out for medical reasons, not just an opt-out. It's got to be very specific. There can be set up some sort of a review group within either the district, or the Department of Health, or the district, that there might be something that's somewhere between health-related, I don't know what it would be, an exception to those acknowledged exceptions, but that's where I stand on this thing. So I'm not gonna bore you, but when I hear I have a daughter who's had a pediatrics at Mass General Brigham, in Boston. She focuses her clinical time in the newborn nursery, the number of COVID mothers. I mean, you know, it's and this is Massachusetts, which is much more concentrated in terms of how people live than, you know, the more rural nature of the state of Florida in general, or even here in Indian River County. So enough said from me. That's my position on all of this. Yes, ma'am.
Can I follow up? You know, you mentioned Beachland being a hot spot, but yet I'm looking at the data, and we have 10 teachers that have COVID, but it says only 4 students, and yet we've gotten emails saying that the whole 3rd grade is sick. So what's the answer there?
Through the chair, I believe that we're working some more cases at Beachland today that'll come up on the dashboard. Also, you've got some that may not have taken their child to get tested and haven't reported.
Okay. And I don't want to close schools, obviously, and I do care about kids getting sick. So, you know, some board members have said that they care versus us. I'm going to tell you, I care as well. And I will say that, Ms. Rosario, depending on what you hear about the Delta variant testing, some people will say, no, there's not a test, there's not a test. If you look on the CDC, it'll say there's a distinctive biological marker test. It's called a genome sequencing test. It's not done.
I just mentioned that.
It's not done as often because of the cost and the availability. But there is that. That's why they're not doing it.
I mentioned that.
Yeah. So the employees did find out, I found out about employees, you wanting to put masks on employees during my meeting with you on Monday, so I appreciate that, being informed as a board member. Thank you. I'm sorry that Ms. Rosario found out by email. I'm not sure what happened there, but I appreciate the fact that you discussed it with me ahead of time. The mask study, I did refer to that mask study that was done. Schools had masks versus schools that did not have masks and how it affected their community. It is a CDC study. You can see it. It was done on May 21st. So this is a study that's out there that says maybe masks work, maybe it doesn't, but it had no correlation to the community's increase or decrease. So I understand that you say it's an easy decision. I don't think it is. And Dr. Schiff, you said that, you know, you're fine with masking kids all the time. The question is, here we've gone through a whole year of doing this. How much longer are we going to do it? Because we've got the Lambda variant behind it. So that's really concerns me. Are our kids going to be wearing masks until they're adults, you know? And whether or not the vaccine is coming fast enough that people trust it to be able to use it and have it for their children. You know, my concern is we do this to children, we're going to wind up with, again, depression and respiratory illnesses and all those other things. Now, do you weigh that with, okay, Delta variant, could my child die or not? Again, you know, have we seen that yet? Have we seen deaths? Have we seen that stuff? And are we seeing kids commit suicide? Yes. Are we seeing depression? Yes. Are we seeing this taken out of the hands of parents? Yes. We have parents that want all kids masked so that their kid is safe, okay? But then we have parents that don't want their child masked because of other reasons. So this is not an easy decision. How long are we going to mask for? And Dr. Jones, Scott Samples probably wasn't calling you because he was on the phone with me last night.
Quite a bit.
So part of the problem, I think, that we had compared to St. Lucie and why their numbers are looking better than ours is because we have a lot of adults that weren't masking. And kids, let's face it, especially elementary kids, which I have been a teacher in elementary school, so I can tell you this, they will look to their guidance of their adults. If the adult is wearing the mask, they're more apt to wear a mask. If they like the mask that the parent has chosen for them, they're more apt to wear their mask. Have we done that? No. So we're going to move right from optional masking to mandatory masking without taking that step. That's my concern. Why not take that step and gradually move to this and see, okay, if we do that for another 2 weeks, what's going to happen? Also, we haven't had parents have that virtual option. Now they have that chance to get the virtual option until what's the cutoff date?
Through the chair, my recommendation was if you were going to make that transition, that the time would be now to make it. So I announced that last Friday.
Okay,
so.
and I understand, I'm fine with masks being mandatory. The question is the opt-out policy. You're saying opt-out only with medical. Now we're getting into whether or not we're going to go to court, whether or not that's a medical device decision that we're making, okay? The next issue is, why not strengthen that opt-out policy we have now to see if that works? Granted, are we doing a social experiment? Are we doing a science experiment? Are we changing one variable at a time instead of 3? Now, I'm comfortable with mask mandatory, make that mandatory, and then a strict form being filled out by a parent that they must have. Otherwise, that child is reminded to put their mask on, or the parent is called, like we did last year. I'm telling you, the things that we went through in our schools for administrators to have to deal with and teachers to have to deal with the masks, they were so excited when those masks were taken off because they didn't have to deal with all that again. And now we're telling them you have to deal with that again. I'm not saying I don't want kids masked. What I'm saying is you're totally taking the power away from parents again. And I think that we need to mandate masks with a very powerful opt-out form saying that you have to have that form filled out and sent in, and we're going to follow up to make sure that form is in for a child to remove a mask.
So I have a question about that. How is that going to be enforced?
Again, how did we enforce it last year?
Well, the problem is that this year, we're clear that nothing's being enforced. People have filled out the form, not filled out the form, kids are wearing it,
Right,
they're
but
not wearing it,
adults aren't
teachers.
wearing masks either.
Yeah, so any kind of opt-out, whether it's medical or parental or any other thing, has to have a structure for enforcement. It's difficult for teachers. We have to make that as easy as possible on teachers. I'm not exactly sure yet how we do that. When we have policies that are widely divergent, like now, we advertised all over the parental opt-out, a little over 18% completed that. There's no structure for enforcing who is or is not, so it's the inverse in schools for who's wearing it. When there's a consistent policy, it's far easier to enforce that policy. When it's just what we do, and then the opt-out is, there's a structure to keep that so that it is the minority of the cases, not the majority of the cases.
I understand that, but I'm saying to have a stricter opt-out policy where a teacher says, okay, I've got 15 kids right here, 2 are being opt-out, I know who those 2 are, I get it, I'm not going to say anything to them. That's what St. Lucy's doing. And then
Well-
the other kids are saying, reminder, you have to wear your mask, reminder, you have to wear a mask, and if they're not, they're following up with a phone call home.
In Palm Beach County, they made it even stricter. In Palm Beach County, it's a medical opt-out that has to go through a 504 process.
Ridiculous.
Oh my goodness, you want to take that much time away from our
That's
staff
ridiculous.
again?
I'm just saying what they did. I'm not saying it's what we're doing. I'm saying they even upped the level of how strict they were making the opt-out policy.
We'll see how effective that will be for them.
Well, I don't know, and I'll find that out because I'm in communication with them. And Terry, I didn't mean at any point to imply that nobody else here cares. I'm absolutely clear, and in many of my communications, whether they come from me, well, they can only come from me, but I say the entire board is concerned about that. Of course you're concerned about that. I don't mean to minimize that. I think we have some different perspectives on this, but the reason we have different perspectives, and we talk about this for so long, is because we are all passionate about it, despite our different beliefs on how we best protect our students.
Are we partnering with parents, though, when we do this?
Nope.
One of the other things that comes up consistently is the notion about the degree to which parental rights trump communal public health. And I've seen that in innumerable articles. I've seen it written to us in emails. Where is the line between individual parental rights and community health, safety, and well-being? I don't pretend to know the answer to that. I don't have it. But I do think it is a consideration that warrants our attention, because as I think it was you who mentioned, you've got an email, no, it was, I think, Mr. Barefoot, who said, we've also gotten communications through email, voicemail, text, however we get them, suggesting that there are a number of parents in the community who are concerned that their parental rights are not being honored because they're forced to send their kids to school in unsafe environments.
I mentioned that.
So how do we honor those parental rights equally as those who feel that it's safe for their parents?
But didn't we do that last year? And the ones that didn't want to follow that had to go home and go online and take school, right?
Well,
So-
last year we
so
had those options,
If we're
this year
having
we
less
don't.
kids wearing masks this year when they have that option, right? It's not the majority wearing the mask. So now we flipped it.
Yeah,
So
well-
why aren't those kids then able to go online?
Well, what's happening, though, as per Dr. Moore, is that parents are starting to keep their kids home because they don't feel safe, particularly their elementary school kids who are not eligible for a vaccine. So to what degree is it our obligation to ensure that those kids feel safe in school and those families feel safe who don't now feel safe
So
coming to
then,
school?
would we consider doing this for kids that are older than 12?
Consider what? Consider
Would we
doing what?
consider a mask mandate for a difference for the two different age levels?
We haven't had that conversation yet.
Ms. Rosario?
Thank you. Dr. Moore, at the beginning, on the onset of this presentation, you said that the numbers are fluctuating daily. We have several days on there that there were no cases of COVID. You also said that numbers this week are significantly less than even last week were. You then said at the tail end of this, just a little while ago, because it wasn't clear at the beginning, that yes, you are going to bring a recommendation to the board. So my question to you is, it appears as if this too is also a little too premature if you are going to bring a recommendation to us tonight. Because our numbers keep fluctuating, we haven't had a significant amount of time to enforce teachers wearing, or, instructional staff wearing masks or staff wearing masks, see where it goes from there. We haven't had enough time to watch the numbers within the district. So I would just venture to say that we need to wait a little bit before you bring a recommendation to us, whatever
Well,
that
just a-
recommendation is. And lastly, when you asked, just lastly, you admitted that it's just a play on words, that using the word recommendation and using the words mandating, it's a play on words.
Right.
Because it's, you're still offering the opt-out.
So these are, what I mentioned, these are the percents by the county. So what I said there, they are actually increasing as they are, but the state numbers in terms of the percent of cases actually went down. So what I said there is you're seeing a decrease in the state, which is a good sign, but here locally, it was still a 16.01 increase from the week before. And that increase was less than the previous percent increase. So it is slowing down here based on that data, and from a state's perspective, it actually went down. Others would argue that's the home test that's playing a variant in that. When you look at the zeros here, by no means does it mean that they were not cases. It means that we didn't work them because that is a Saturday or a Sunday. So what we did on 8/22, which was a Sunday, is gave up that time to get ahead of the particular cases. So when I look at the numbers, I agree you have to respond and react to that particular reality. It is fast moving. So one of the pieces of paper that Mr. Bass slid over to me is at Citrus today, only 50% of the students are at school.
Wow.
Only 50%, not because they have COVID, not because they're quarantined, because they're simply making a decision in that environment. 129, so okay. So
Hold
I
on,
take that
129 out
Take
of
that
how
back.
many total? What's
Wait,
that
You're
percentage?
taking that back. Correct that.
129 out of how many? So, okay, that's not nearly as bad
That's
as I
not
said.
50%.
No, that's not nearly 50%.
They don't
We need
have
to be,
1,000.
because we can't get that on
So
here.
I could add that, they're on an average day with no COVID, they would average about 50 absences.
Okay.
So we got the 50.
So on average, 50 absences, but currently we have 129 absent out of 1,000.
But we don't know why.
But that's
Right.
double the rate that would typically be out.
700 students.
Okay, so 100-something are absent out of 700 students.
Which is over twice the rate that we typically see absent when we average over the course of some amount of time, correct?
And
But we don't know if that's all positive cases.
No, that's not the point.
Well,
The point is
makes a
parents are keeping their
difference.
children home because they don't
so
feel safe.
I think the reality is, and my driving force here in any recommendation that I would make, and yes, I would make a recommendation in real time based on what I'm seeing. And this rate, once we get a full 10 days out, now that school has started and we're fully in, we're going to have about 7 to 8% of our instructional staff out, and we will not be able to cover that. We will not be able to cover that. I think all things considered, we have to protect a free and appropriate public education for children. Each and every one of you know how I feel. I do not want to move. I don't want to increase. I don't want to put masks on anybody. But when I look at our primary responsibility, it is hard for me to swallow what the mitigation strategies that we currently have in place are not working. And they're not working in our elementary schools, to be specific. And if it continues to grow, as I've said, that's going to be a problem. So I've had the opportunity to listen to board members. I don't think waiting longer would be the right decision to make. I think we've been convened. This is probably the only school district in the state of Florida that hasn't met since. So waiting long, since the Delta variant started to grow, because we canceled the meeting proactively months ago for August 10th. So we haven't had this convening. So I'm glad that we are here. It's unfortunate that we're here in the midst of this reality. And it's unfortunate that we have to make a recommendation to be voted up or to be voted down. That comes with consequences. Comes with consequences one way or the other. And the driving force is, what do we want those consequences to be? Because we're going to get them. We're going to get them. And it hurts my head and my heart that people are not trusting the environments in our schools, and numbers are down. Do I want to put masks on people? The answer to that question is no. But do we need to do something in the immediate future to see if we could offset the growth? I think the answer to that question is yes. I think the answer to that question is yes. And all of the science and all of the research and who we're going to listen to me, it boils down to keeping the school doors open and families feeling safe and feeling comfortable to send their children in. So any recommendation would be around supporting that desire.
Question. I have a question for Superintendent. Yeah, I'm totally agree with making masks mandatory so parents feel safe. I get that part. The question I have for you is, sir, what is the opt-out policy that you're going to recommend?
Right now, if I had to recommend anything right now, it would to require a mask with the medical opt-out from a medical doctor or a licensed psychologist, and implement that going into the August 30th or September 28th board meeting. So a short window of time to offset the reality that we're currently in, and then evaluate it then, bring a recommendation to the board at that meeting to modify, shift, eliminate, or whatever the case would be.
So no exceptions other than a medical exemption, is that what you're saying?
And that would be the
Just like
starting.
last year?
Yes.
That would be the starting point, yes, just like last year, and that would be a starting point in terms of holding a vote.
And again, sir, I voted for that last year because we were under an emergency order.
We're not under an emergency.
We're not.
I agree, and I agree that that is a difficult decision that needs to be put forward to the board.
We should,
Mr. Barefoot,
Dr. Jones?
just going back to principals and teachers and talked to many in my visits, and yeah, this is going to be a pain, but I'm going to tell you, they will do it because it's in the best interest of students. They will do it. They did it all last year. I know we were in emergency order, but obviously a lot of counties feel that we still need to do it. And I understand what Dr. Schiff was saying about, parents' freedom, our right, safety. Looking at all this, we want to make sure safety is the number one. And I think all parents would know that along with rights become responsibilities, and we want to make sure all of our students are safe. So we all have to work together. And I think that's a key there, but we don't have time to wait. We don't have time to wait for your
Question.
recommendation.
Question.
Yes,
Are
ma'am.
we going to have spots in the school, in the classrooms for kids to remove their masks? Because that was a big problem last year is, okay, fine, we mandated masks, kids had to wear them, but we thought they were going to be able to take mask breaks a lot and take them off and all that, and then we didn't have that.
So through the chair, I think what we did in implementation last year, we provided a extreme level of flexibility and making sure our teachers understood providing those particular options, whether it be a mask break, a clear moment in the hallway, opportunities within those particular rooms. What this would be only indoors when social distancing would not be possible, with the additional mitigation strategies that we could simply put back into place where they could have those particular opportunities.
And will students be punished that violate this?
As I said, A, it's not something I really even want to do. But B, it's not the opportunity for us to punish children. It's to inform, it's to educate with the spirit of what Dr. Jones was just saying. This isn't something we want to do for a long time, but we want to keep our doors open.
What's the magic number then we're going to stop it?
I don't know that you have a magic number. I think districts have gotten themselves in trouble when they say it's going to reach X%. For me, it's looking at the overall case by school. It is the downward trend of the Delta variant, which we may be on. It's looking at and saying, can we continue to operate schools? I cannot operate schools when 8% of the instructional staff is out. Right now, even with about 3%, just over 3% of the instructional staff out, and our commitment to quality instruction, all of the development, all of the work that we aspire to do around common planning and growing that as a craft for teachers is support provided by Mr. Meyer's team, and they're not doing any of that work right now, which is fine, but at the same time, we need to build trust with our community, and let's be truthful and honest. There's going to be a high percent, regardless of which way the board decides to go regarding this decision, who will be unhappy, or you're violating my right to choose. And I get it. I understand the complexities of that, but I can only make a recommendation based on this response. And I think each of you know, over the course of the last 2 weeks, I'm very hopeful that these mitigation strategies would work. We can put this motion up. If it doesn't, then you go to the highly recommend or the mandatory with the opt-out. But that's just a play on words. It's mandatory, you can opt out. So it obviously is working better in St. Lucie, and maybe it's working better because they had the masks on the adults, that research that you were citing, very insightful. And then maybe we kickstart it with the required mask and then move to the optional for parents. Put the option back in place. So a limited amount of time, we've got to right the ship. And I know it's difficult, and I know it's hard, and I know those that would support it probably don't want to support it. But they believe it's in the best interest. And that's where my mind would fall as well.
Mr. Rosario.
With thinking about an opting out with a medical form is assuming that the mask would be a medical device. And if you're considering then that the mask would be a medical device or a device, I see a shaking head by Suzanne. Dr. Moore shook his head yes, and you shook your head no.
It really depends upon the policy adopted.
We're not writing policy here.
Right, but it depends upon the procedure, the protocol adopted. The purpose of a medical note from a physician or a psychologist or a psychiatrist is to identify the condition of the student that prohibits them from wearing the mask. So it's not, it has nothing to do with an assumption or a conclusion that the mask is considered a medical treatment. It has to do with the accommodation needed by the student and how that accommodation is impacted by a face covering. That's what the note from the physician or the psychiatrist or psychologist would need to address.
So what is the why not have that as a consideration now, as it's written now, with just a simple opt-out versus having them go to a doctor, take more time off of school, go to a doctor, get a medical note, come back with that medical, what's the purpose? Who's gonna, I mean, really, it's just have them opt out, simply opt out, that's it. Parental rights, the bill states very clearly, as I'm reading it, that infringement on parental rights, 1014.03, infringement on parent rights, the state, any of its political subdivisions, any other governmental entity, or any other institution may not infringe on the fundamental rights of a parent to direct the upbringing, education, and health care. What we are facing now is a healthcare situation. If a parent does not want a child to wear a mask, that is the parent's right. That is the parent's right. If a parent wants their child to wear a mask, that is the parent's right. It also goes on to say, and mental health of his or her minor child without demonstrating that such action is reasonable and necessary to achieve and compelling, and you've read the rest. I do not believe that the opt-out portion, I'm just talking about the opt-out portion, that the opt-out portion should include having parents provide a medical note for that. I think they should just opt out. Simply what is written in the executive order, simply what is written by the DOH in terms of their recommendation. Simple and sweet, just opt out.
Dr. Jones, you wanted to?
I think we should go back to what we had last year, the mandate with the medical. And I know Representative Grahl did a lot of work on this and started years ago with this bill, and she's worked very hard on this. But one thing when this went on is that we were not in a public health crisis, not only in our county and state, but in our nation. And I do believe that we'd all be looking at the safety of students as the #1 priority. As I talked about before, with rights and responsibilities, we all want to do the right thing. Every one of us wants to do the right thing. And I'm fearful that if we just do the opt-out, we'd be where we are now, and kids are not wearing masks. That's what I'm fearful of. And I just think as a board member, I want to see what we can do if whatever you recommend, Dr. Moore, whether it's a certain number of days or positivity rate, whatever you think is best on there, and we discuss. I think we just have to do everything we can to contain this now, so we don't lose time in school with teachers being out. We don't lose extracurricular activities that could happen, as we all know, at any time, and that our students and staff do not become sick. So I think it's important that we look at our responsibilities here to our students.
If you're asking people to mask out, if you're asking people to opt out of medical, or to provide an opt-out, a medical opt-out, then the assumption is that masks are medical. That masking would be for medical purpose, and therefore we need a medical opt-out to allow you not to have the mask. that you're crossing the line there. We are going to be crossing the line that we should not cross.
Mr. Barefoot, may I?
Yes,
Maybe we can-
and I've got a
Yeah.
suggestion. Go ahead, Dr. Schiff.
My understanding, as Suzanne was saying, is that the reason there would be a medical opt-out is because the child has a condition which is impaired or which is further impaired or harmed by the use of the mask. The mask itself is not a medical device. The mask itself presents a hardship to the child who suffers from a condition, be it psychological, behavioral, or physiological, that prevents them from being able to wear a mask all day. It's not in itself prescribing medical treatment. Secondly, I think we're having this, Dr. Moore brought this forward to receive board input and to get our input to determine what recommendation to bring to the board. I think he's heard that. I think it's pretty clear where all board members stand. I think we could belabor this for hours, but I don't know that it's going to change the position of board members. I'd like to suggest that at this point, we charge Dr. Moore with bringing forward his recommendation to the board, and we'll vote on it later tonight.
One possibility, we have three, the next meeting is September 14th, correct?
Yep.
That's 3 weeks from now. Rather than waiting until the 28th, which is 5 weeks from now, whatever recommendation you bring forward, have it be reviewed for, it's a 3-week recommendation to be reviewed at the September 14th. The benefit of that, that's a week after Labor Day. If in fact the Labor Day weekend produces some additional information, family gatherings and all the things that go on holidays is a possibility. Obviously, if we wait until the 28th, there's a greater possibility. I don't know whether 3 weeks is enough time to evaluate where we are versus 5 weeks, but that's a shorter period of time. And seems to me it's not unreasonable, at the very least, to at least review it with the possibility of modifying whatever it is that we do adopt based on your recommendation. Just a suggestion.
Through the chair, so I appreciate that, and that is not how I was looking at it, but maybe bringing a recommendation to move to a mandatory with the option to be implemented for X number of days, the next board meeting, and if the local conditions, the internal conditions do not improve, then the recommendation would be to move to a mandatory mask. I think that is a starting point for the district that I could proffer to the board. And let me say that again. We now have all adults required to wear a mask. We shift from a highly recommend to a mandatory and enforce that recommendation. Follow up the, I want to say consequences because that's not what it would be, but those compliance with the directive provided from the parent. If that does not yield the appropriate percent of the opt-out, meaning 20% opted out, only 20% are not, and the numbers are not moving in 2 weeks, then the recommendation would be the big boy that breaks the law and requires the masks. So I don't know if that would be approved or not approved, but that would be an initial recommendation. If not approved, then we move to the next level, which would be a full-on mask mandate.
I was thinking something a little different. I'm thinking that it's mandatory for 3 weeks.
Yep.
And if conditions improve, then you're able to back off in some form or fashion, whether it's the specificity of the opt-out clause or some other modification, as opposed to, I don't want to wait 3 weeks, but I would like it to be formally reviewed in 3 weeks to make any adjustments, hopefully less onerous, call it, rather than wait 5 weeks. That was what I was trying to say.
All right, understood, and through the chair, we will have to onboard the program, so implementing would take probably into Monday of next week. So taking all consideration as varied as it is, I will put together a recommendation. Once I turn over that recommendation, it belongs to the board. Now, it could be changed or modified based on what the board would like to do. through the appropriate voting process, and then we could vote it up or vote it down. But I will add that recommendation as we move into this evening.
Is there a way to tee that up, and this is really for Mr. Agresta and you, so that I don't screw it up, but is there a way to move that vote discussion right up front? Because we could have a lot of people here tonight, and I think it would be wise to get at this first thing, since it's going to be on everybody's mind. Okay. All right.
But we need to listen to citizen input before.
No, but
Okay.
yeah, let's tee this up as a specific discussion item, action item, not whatever else you might pull out of the consent agenda. I don't know what it might be. But you're right. But I would like to have this teed up right away, because it's what's on everybody's mind.
Mayor?
You sure?
I could support what you suggested before, Dr. Moore, which is what I suggested at the very beginning of my conversation was, as a scientist, you change one variable at a time to see if that works. And what we're doing is we're pulling all variables back. And so, okay, let's say that works. Well, then at what point are we going to ease it up again? Because we eased it up totally, and then we got this variant. Again, we got a lambda variant possibly coming at us. So if this study is correct, then if we went with his suggestion that he just said here, which is changing one variable, in other words, putting masks on adults, then we'd see whether or not this study is really true that the CDC did and found that that works. And that's what St. Lucie is finding. But if we pull it all back and say, no, parents, you don't have a choice, now we've done the big boy, like he says. Why can't we do the stair-stepping for the 3 weeks? Kids, especially young children, are going to look to the adults and say, they're wearing their mask, I'm going to wear my mask. We're hoping that that will be the case. If we do what St. Lucie does, I think you'll see more kids wearing their mask without having to be Big Brother and saying, you will wear your mask that way, like we've done. This is more stair-stepping and partnering with parents who really have an issue with this. Because if we don't do that, now we've turned around and said Monday's a day, now you're going to have all these parents saying, I've got to run to the doctor before Monday. That's my concern. Is if we can partner with parents and we do what we say, that we put it on teachers and staff members and encourage kids, absolutely, it's mandatory masks, but you can have that opt-out form that a parent has to fill out, and then the child is being told, hey, your parent didn't fill it out for you, you need to wear your mask. That's stair-stepping to stronger versus going all the way to the other side.
I might support that one.
I would
Without the
support that
medical.
100%.
Opt out without medical.
Yeah,
Dr. Schiff, go ahead.
I really don't want to belabor this conversation, because I think,
You keep saying that, but I think we have a right to talk about this because it's a huge issue.
I totally agree it's a huge issue, and I wish that we had planned better, frankly, which we didn't. The idea of changing one variable in a scientific study is when you have a scientific controlled environment. We don't. We have a public health crisis. So I'm not clear that I want to implement certain steps to see what happens at the risk of people who may become ill. This is not a controlled environment. Secondly, what you're citing from the CDC, I just looked up. So as of August 9th, and I think you said yours was in May?
It's May 21st.
May 21st. As of August 9th, they say several findings are noteworthy. First, higher numbers of cases are observed when community rates are higher. Second, children can acquire SARS, yada, yada, in educational settings and transmit to household and non-household members. Third, when prevention strategies are in place, secondary transmission appears uncommon. And they list a whole number of studies that say that. This appears to be more recent than the May study.
The
These
Stanford
data-
study is recent too.
Well, this is as of August.
Yeah.
And we keep getting stuff, daily, as we know. New studies are coming out daily. So I'm not sure I agree with the notion that what happens in schools doesn't mirror what happens in the community, which I think is, correct me if I'm wrong, which is the study that you're pointing, the findings of the study that you're pointing to. But it suggests here quite the opposite on a more recent CDC page. And I'm happy to forward this via Nancy after this meeting.
The other thing to consider too is there's going to be a ruling on Thursday by a judge. Do we not care to listen to that ruling?
These are all good points,
Do you
Dr.
want to waste
Johnson.
money on that?
In a second, there's really, what you're saying, there's either we step up, or we start at the top of the stairs and we back off if conditions change. Either, you've got flexibility either way. Dr.
just gonna
Dr.
say,
Jones?
I agree with beginning this now and then taking a look at it in 3 weeks, as Mr. Barefoot said. And yes, it could cost us money, but I think a lot of other things could cost us more.
And so you're still going with the thought that masks are going to prevent transmission of this disease?
And exactly what Dr. Peters said, masks do help deter this disease. He said people who say masks don't help, they are wrong. I'm not the medical expert here, but that's everything I read.
But that's my whole point.
He is, though. He
Right.
is.
But he's one of.
He's the chief medical officer at Cleveland Clinic. I mean, I tried to do all my information with locals, so, we all have a differing opinion on there. I guess you bring the recommendation and we vote.
I'm not saying masks don't work. That's not what I'm saying.
What are you saying then?
I'm saying that what you're asking is not to partner with parents right now. And I think the stair-stepping that I'm asking for is to partner with parents for 3 weeks to see if we can make these numbers change. And then if not, go to the big boy, I think I understand that we're in a crisis. I understand that. If deaths were happening faster, I would definitely be with you, and let's go to the end really quick.
I just hope they don't happen.
But death
I
is not the
understand
primary
that.
indicator here. We're not looking only at death. We're looking at consequences. We're looking at health and well-being. We're looking at long-term consequences. We're looking at the impact on families. There's so much more here than simply mortality rates.
I understand that. When we first were asked to do this, remember, we were asked to do this because you weren't on the board yet. We were asked to do this because of our ICU units being too full and all that, right?
And then that came down, and now it's going back up.
I understand that, but it's not full yet. I get that.
Well, I'd rather not wait until it's full and until there's no available care for those of us who get sick.
That's right.
They're not full with children.
I will make
Children live with
a
adults.
recommendation that the board could consider, vote up and vote down, acknowledging that we are on separate sides as a board. And I will say, once again, the driving force has to be, what can we do to keep schools open and families connected and involved inside of classrooms? And we've got to make that priority number one. Thank you.
All right. It is almost 1 o'clock. April, sorry, we've been at this for a while.
We get a lot of feedback.
How would you, the other items that were on the
Just wanna add
agenda?
one thing.
So my recommendation is we do have a number of items. All of those items have been reviewed for board members. They are up for approval tonight. They are the review of contracts by Mr. Fagan, review of the Treasure Coast Technical College tuition fee schedule, the professional learning handbook by Mr. Meyer, and the review of the student progression plan for 21-22. And then the instructional material manual also by Mr. Meyer. In respect of time, and April coming to spend time with us, if there's any specific questions staff would need to answer for board members regarding any of these items, we would be more than happy to address those items at this time.
Dr. Jones?
Just the one thing I have on legislative platform, you have the attachments that we as a board can send in together, or since we are members of the FSBA, we can send in individually if you want to look at a certain platform proposal for FSBA to consider. I am going to be on the legislative subcommittee, so I can take those to them, no cost to the district, but those were in your attachments. It showed what their platform was last year, what our platforms were. They coincided. Mr. Bass and I talked about that. A lot of them are the same with the superintendent and so forth, but if you can think of any that you would like You can send it in on your own, too, as an individual. But I know Ms. Berenborg said something earlier about the platform with virtual learning. So if we want to do that as a board, we can do that. You can just email them to me, and I will get them to the FSBA. Or you can send them in individually.
The other reason why I was excited to see this on the agenda is because September 8th is when we have the delegation meeting.
Yes.
And it would be really important, I think, for this board to say, this is important for us, this is our first thing, have that legislative platform that we've already developed that you're saying to tweak. I think the one thing that's come up, well, one thing I keep bringing up is the funding, so we don't have to go out for a TAN, okay? Asking not for different funding, but a different way of giving us our funds back that have gone from the taxpayers up to Tallahassee. So that part, I think, is already on our legislative platform, needs to stay there, but I think that's a priority that needs to be brought to our two representatives. The other thing is funding for online courses. That is new because of the situation we're in.
Right.
That was not dealt with and talked about before because it was under the emergency order.
Right.
We were getting that funding.
Good point.
Now we're not, so I think that's something.
They are due September 1st, so if you,
But if we brought them up tonight.
Sure, that's fine,
You'll
too.
get the feedback, and then you can, correct?
yeah, that's fine.
All right?
But you
And
just
and do
reviewed
these
it.
other items, Dr. Moore, are they to be voted on as
They,
part of the consent agenda?
To do tonight.
They are to be voted on this evening. They all have been prepped 3 or 4 weeks ago with board members. So if there's any questions that need to be answered, we'd be more than happy to do so at this time.
Yeah, I have one, but Mr. Fagan isn't here. I guess I'll get with him at some point. But I just wanted clarity on the purchase of the scrubbers, $61,000 for rental, long-term rental of scrubbers and floor devices. Just wondering why we don't own our own.
Through the chair, the maintenance of them they're very costly machines. As you know, these are I forget what they are, but as a former principal and assistant principal, maintaining them is an additional cost. And what we've learned, this actually comes in at a cost savings because they were actually leasing them or renting them. They come in, they provide the service and the upkeep of the machine. So the life of the machine is ultimately extended, and the efficiency of the machine is always staying current. So this is Mr. Fagan doing what Mr. Fagan does with team, looking for ways to save money in the long term.
Yeah, it's an RFP, but I thought that we owned our own.
I think we're shifting to this particular practice over time. So I think the answer is yes. Currently, we have the scrubbers and those machines that do those floors in the building themselves. But this is a shift or a change in practice where we're actually leasing them versus replacing the old ones.
So these items, these scrubbers and whatever it is that they're going to be housed at the schools, and then our maintenance crew uses those. If there's anything that goes wrong, the rental includes replacement or maintenance and.
Yep, correct. So they'll come in and service them, whether it be during the day or the evening. So very similar to a car lease, it comes with the service and the maintenance of that car available.
And what I understand is this is just for a year, because it just says 12 months.
Right, and then we would do it over the course of we have to do it over.
And then next year, we do this all over again? So at the end of this year, are we going to reevaluate whether that was effective? Could it be beneficial for us to purchase our own at that point? I just want to be able to compare, so a better comparison, since we owned our own, now we're trying a new system, for us to reevaluate whether that switch was actually effective or not.
Yeah, and the answer is yes.
Okay.
You're also switching, when you buy, it's part of it comes out of your capital budget. When you lease, it comes out of your operating budget. There's a difference on the budget impact, one versus the other, unless there's something strange about public school accounting. That's the way it would work in the business
It is
world.
strange.
Mr. Barefoot, I just wanted to say to Mr. Meyer, really good job on the professional learning handbook. I thought that's something that really looked good, and the student progression plan. The detail in there, I thought both of them were very good. Thank you.
And thank you for the addition of CRT. statements in there.
Yes.
All right, I'm going to, the meeting is called to a conclusion at 1 o'clock. Why don't we reconvene at 1:15? Is that,
I just got to get my lunch.
That's
I'll bring
fine.
it back.
and April, we apologize. Some will be eating while you're leading.
Exactly.
You did.